I'd like to call the Finance, Ways, and Means Committee to order for Monday, March 8th, 2021. Mr. Clerk, would you please call the roll?
Representatives Campbell, Camper, Crawford, Faison, Freeman, Gant, Garrett, Gillespie, Hawk, Hicks, Lamar, Lamberth, Lynn, Miller, Ogles, Sexton, Shaw, Sparks, Todd, Whitson, Williams, Wendell, Zachary, Vice Chairman Baum, Chairman Hazelwood. Madam Chairman, you have a quorum.
Thank you, Ms. We've got several budget hearings scheduled today. It's another marathon, so hope everybody's had a good weekend and ready to go. We have, first up, the Department of Mental Health and Substance Abuse Services. And before that, I suppose I should ask, are there any personal orders or announcements from anybody in the committee? All right, seeing none, we are without objection, out of session, and we would invite the Department of Mental Health and Substance Abuse Services and our very shy Commissioner Williams to come forward.
Good morning, members of the House Finance Committee, Madam Chair Hazelwood, Vice Chair Baum. It's a true honor and privilege to be with you guys this morning to present the Tennessee Department of Mental Health and Substance Abuse Services budget request for fiscal year 2022. Joining me are Ty Thornton, Chief of Staff and Hospital Administrations down at the end, Matt Yancey to my right, Deputy Commissioner of Community Behavioral Health Programs, Heather Gunderson in the audience, Deputy Commissioner of Administrative and Regulatory Services, Jean Wood to my left, our Budget Director, Taryn Sloss, who's our Assistant Commissioner of Substance Abuse Services, Rob Cotterman, who's our Assistant Commissioner for Mental Health Services, and Matthew Perriott, who's our Director of Communications. In addition, watching on the web, we have our amazing staff, provider, family, and peer organizations. Chair Lady Hazelwood this past year has presented many challenges, triumphs, and opportunities. This past year's goal for our department and those we serve has been to be legendary, and we can report to you that we have been that in every way. Of 41 states that reported on access to psychiatric inpatient services during the COVID-19 pandemic, half said they reduced capacity or suspended admissions. Not ours. Because of our hospital team, their determination, their knowledge base, their work ethic, and compassion for those needing inpatient treatment, we changed procedures, protocols, instituted safety measures, and we stayed open, fully open, with no reduction in beds. Legendary for our community substance abuse and mental health providers who serve almost 400,000 Tennesseans every year. They turned on a dime, effectively, efficiently, and creatively responded to the needs of Tennesseans living with mental illness and substance use disorders. During an unprecedented time of this pandemic, thanks to telehealth that you all passed, we have actually increased numbers served through the behavioral health safety net. Words cannot convey the amount of gratitude felt for Tennessee's amazing community, mental health, substance use, peer, family, and faith-based institutions, as their dedications to Tennesseans living with mental illness and substance use disorder has made all the difference in the world. Due to their heroic efforts, we stand before you today knowing that this work has changed and saved lives in the greatest time of need. Going to our budget slide, if you will turn to slide 1, you'll see that our mission has been to create collaborative pathways to resiliency, recovery, and independence for Tennesseans that are living with mental illness and substance use disorder. And you'll see our vision is a state of resiliency and recovery in which all Tennesseans living with mental illness and substance use disorders can thrive. Going to the next slide, you'll see that our values that underpin all that we do and those that we work with include a customer-focused response, integrity, honesty, and truth in all we do, inspired purpose, excellence for all services and conduct, compassionate and effective leadership, solutions and outcomes oriented, and finally, partnership with those throughout our state. This next slide will show you a video that's been played so that Tennesseans would know where to call during the COVID-19 pandemic.
We need to get you some help. Crisis Services, this is Liz. How can I help you? We need to find a better way to control that feeling. Okay, so you got this job that's not making you really happy. It's a long time to have to struggle with this. We're going to set up a safety plan for now. Implement some things that really bring you some joy.
Would it be okay if we gave you a call back tomorrow, check on you and see how you're doing?
Someone is always here to take your call.
24/7, 365.
And someone is always here to listen.
That crisis line is vital to Tennesseans 24 hours a day, 7 days a week, 365 days a year. This next slide is fascinating because for the first time in my career, and I've been working in this field for 30 years, I want y'all to see how close we are to closing that gap of serving Tennesseans that are uninsured in this state. Because of your funding for the safety net, you'll see that the estimated is about 44,800. Last year, because of the safety net, we served 39,100 of those Tennesseans. Do you see how close we are? It is amazing. Going to the next slide, you'll see we're not as close on the substance abuse side. And we are working so hard through our budget and through other grant dollars that we go after to meet that gap. But you'll see we have about 52,400 Tennesseans struggling with substance use disorders that are uninsured. Last year, we served about 19,851 of those individuals. Going to the next few slides, I'm not going to spend a lot of time on these, but we had been asked to show you the indicators of anxiety or depression during COVID. Dropped initially during COVID-19. They rebounded to normal levels, though, by summer of 2020. And telehealth played a huge part in our ability to serve Tennesseans. You'll note that hospital-reported opioid overdoses actually came down. They spiked in the middle of the pandemic, but have come down. And then you'll look at our slide that shows our hospital staff, the regional mental health institutes, who have performed extraordinarily during this pandemic. Important number that Deputy Commissioner Yancey was responsible for and working with statewide organizations. It was low cost, high impact, where we can allow anybody that's a healthcare worker or a first responder or even a teacher or somebody working in education to call and get support. We're proud to say has the majority of the funds in services. 94% of our dollars, as you can see by that inner circle, go to services. And those services are in the community through our community mental health providers, our community substance abuse providers, and our mental health institutes. Down at the bottom, you'll see 22% of that funding is federal funding. That's due to the hard work of our staff that go after every dollar that they can to bring into the state of Tennessee to help leverage our precious state tax dollars to serve Tennesseans. Going to this next slide, this is the breakout that you guys have of our budget. You'll see we're asking for an increase in the safety net. I'll explain that in a minute. And the Creating Homes Initiative, residential recovery courts, criminal justice liaisons, the private East Tennessee inpatient cost, mobile crisis services, RMHI, revenue replacement, and capital improvements for a grand total of $44,045,300. Now, to describe those proposals briefly on the safety net, it's not to add dollars to the safety net. It's to increase that safety net of services for kids. That is the focus. So it will expand community-based safety net type services to serve additional uninsured kids who have a serious emotional disturbance. The Creating Homes Initiative would allow us to expand that very successful program to allow those that are diagnosed with mental illness and or substance use who are coming out of the reentry population to be able to access safe, affordable, quality permanent housing. Our statewide residential recovery courts, as you all know, are very successful. This funding would allow us to actually create 2 new additional residential recovery courts. Criminal justice liaisons, those are the people in our communities that work with your local jails and criminal justice individuals to be able to coordinate care once a person leaves jail and hopefully get them out quicker than what they should be in there for. Mobile crisis services, we have 13 mobile crisis providers. This would allow us to increase their service delivery by $354,000. The $1 million recurring for the East Tennessee private inpatient costs. As you know, we closed Lakeshore. This would allow that to be recurring. You put it in year after year. It's been non-recurring. So we're now asking for the recurring costs there. RMHI revenue replacement, that's recurring funding to reflect the changes in our patient population mix. Since we've been here, we have seen a huge increase in uninsured Tennesseans that are in need of inpatient hospitalization. That is where they are committed involuntarily. Because of that shift, we are asking for that revenue replacement of $10,105,100. Next slide is our proposed capital improvements. $11 million for a Middle Tennessee Mental Health Institute mechanical system upgrade, one time. Moccasin Bend Mental Health Institute electrical repairs, one time. And Western Mental Health Institute kitchen repairs. That total is $17,190,000. On our reductions, there are no proposed reductions in this budget, which we are grateful for. No change in positions in the proposed FY22 budget. And you will note that we reduced 18 vacant positions in FY21 for a total savings of $1,121,100. In closing, we clearly understand there are many important needs in our state and limited resources. We know that for every dollar you put towards recovery and resiliency services, you will net back more than $7 that Tennesseans will put back into their communities. That investment is paying dividends as Tennessee climbed 11 spots since last year to number 28th in the most recent Mental Health America ranking of the 50 states. We know further that every industry, sector, family, faith, school, and community has been touched by untreated mental illness and substance use addiction, for which there are evidence-based prevention, intervention, treatment, and recovery supports. We also know that you, the members of the Tennessee General Assembly, Governor Lee and his team have all exhibited, both in word and deed, support for our brothers and sisters who are struggling. Our budget is for those individuals and their current and future families, communities, and the generations of Tennesseans to come. A future of hope, healing, recovery, and resiliency for all. A future that we all will be proud of, not just for government to solve, but in public-private partnerships, outcomes-based with one another. This concludes our presentation, and we're happy to answer any questions that you might have as we move forward together. Thank you, Madam Chairwoman.
Thank you. In a incredibly challenging time to see that we have not cut back on services, but actually been able to provide more and to provide them more effectively through things like telemedicine. And I just want to commend your department, and I know you have a very dedicated staff across the state. I think we've all been impacted, whether or not we've had COVID. We know someone who has, and we've all been impacted by the isolation that it's caused for people who live alone, particularly, or whatever. I know that's been very difficult, and I'm not surprised to see that there was that uptick in calls, and I'm just glad that we as a state were able to provide somebody on the other end of the phone to help people through that. So I know number 28 up 11 spots.
That's amazing.
That's amazing. Puts us in the middle of the pack, and I know that we would all like to, Tennessee doesn't like to be middle of the pack. We
We're going to be
prefer
in the
to
top of the pack.
That's right. We prefer to be the
Mhm.
lead dog.
Mhm.
So we have, thank you for the work that's been done. I do have a number of questions, so we'll begin with those. And just you can indicate anyone on your staff or whoever wants to answer them. I would just ask for staff members who haven't yet spoken, if you are going to address a question, please identify yourself for the record. So first on our list, Chairman Hawk.
Thank you, Madam Chair. Good morning, Commissioner
morning.
Williams. Thank you to your team. You mentioned, I've got a couple questions if I could. You mentioned the
sir.
East Tennessee Private Inpatient Cost Support, the $1 million. Thank you for putting
sir.
that in the budget and making that recurring so we don't have to beg, borrow, and steal for that budget conversation. So thank
Yes,
you
sir.
very much. I want to ask you a little bit about the $4 million that the General Assembly appropriated for transportation of mental health patients. I see that those funds have not been expended and just want to get an idea of where we are with that and which counties, which communities can expect to
Yes, sir.
see those dollars.
Yes, sir. Those funds actually were not given to our department. Those funds have actually been given to F&A, and I believe Deputy Commissioner, have they already done the contracts?
Yes, sir, Chairman. Those contracts, my understanding, are being executed. We work collaboratively with the Office of Criminal Justice Programs, with Finance and Administration, but the Commissioner's correct. Those funds are being administered by our partners at F&A.
Okay, and if I could, Madam Chair, if we could get an update on that and maybe get that to the chair lady's office, that would be good.
Absolutely.
I would appreciate that. A second issue, and this is a personal issue that I've gone round and round with. You mentioned the closure of Lakeshore.
Yes, sir.
I'm concerned that we don't have enough long-term residential care beds in the state of Tennessee, both through the publicly funded ones as well as our private entities who are in this business. I'm gravely concerned about that, and I know the last decade we had been in the mood to close facilities. I would like to get from you the number of long-term residential beds we have in the state of Tennessee, and you may have the number now for Moccasin Bend and the other grand divisions, as well as the private care providers, the ones who have long-term residential care in the private care business. As I'm looking at the number of individuals served, I'm worried about the number of individuals unserved and the challenges that we're having. And I see this as a national issue. This is not just a Tennessee issue. This is a national issue where I think we have a deficiency in long-term residential care, and I'd love to get those numbers for you in the future.
Representative, do you mean inpatient hospitalization?
Yes, ma'am.
All right. Just a couple things I'd like to say to you. This is something that we've been tracking ever since Lakeshore closed because we said we wanted to see, does it get worse or does it get better? And will we need to come back and do something different? I will tell you that our census is actually not as high as it was when Lakeshore existed. I will tell you that in our tracking, we actually have seen more private beds come on board, which is why you're not seeing a backlog in the public system, because you got a private public system. I will tell you, we've got that information and it's completely laid out under Chief of Staff Ty Thornton's area, and we will for sure get that to you because that's been very, very important to us.
Thank you, Commissioner. Thank you, Chair Lady.
Absolutely.
Chairman Crawford.
Thank you, Madam Chair Lady. Good morning, Commissioner Williams. Glad to have you in here this morning. I had a question off the questionnaire that we provided you. You indicated a $1.36 million balance for the pre-arrest diversion. My question was number 10. It indicates the number served from the pre-arrest diversion infrastructure program dropped from 5 last year to 0. My question is, why has the number dropped so drastically, and are there any applications that's pending dealing with this program?
Sir, can you go back to which question you're speaking from? I've got the document in front of me, but I don't see question number 10 speaking to that.
It was the questionnaire provided from the committee.
Yes, sir. This,
I may have the question number wrong.
okay. And you're asking about pre-arrest diversion as to why?
It went from 5 to 0. It was 5 last year, it's 0 this year, and I'm just curious why that happened, and do we have any applications?
That funding no longer, it's over. That grant's over. So we don't have continued state dollars in that grant. As you recall, what was really interesting about that grant was the ability to have local counties and cities leverage those dollars. That was a really great thing that they actually got leverage dollars, and those programs are continuing through a sustainability model based on that. So thank you for asking about
Okay,
that.
thank you.
And I'm going to follow up with a question or a mention earlier, the capital projects. And,
Yes, ma'am.
you know, Chairman Hawk has a specific interest in Lakeshore. I obviously have a specific interest in Moccasin Bend. So I noticed that we've got $5 million, I believe you said was for electrical work.
Yes, ma'am.
And I also know that we've been sort of patching this with duct tape and, you know, whatever for quite some time. So at some
Yes,
point,
ma'am.
the facility, I mean, it's just old and it's going to have to be either replaced or, you know, so much work done in remodeling, you may as well call it a replacement. So how does this $5 million, where does this get us down the road? And what are we looking at in terms of ultimately, or timeline on ultimately having to spend a whole lot of money on
Right.
Moccasin Bend?
Well, number one, I want to say that our staff at Moccasin Bend have been amazing at doing exactly what you said, keeping that place together. Moccasin Bend's over 60 years old. It is the oldest institute that we have. Every other institute has been built and rebuilt and modernized. Basically, this information for the funding shows that we've been having a lot of outages with mechanical and electrical systems. And basically, if we don't have that working and operating appropriately, then we're not going to be able to run a hospital because the systems are like 60 years old. As it relates to where things are with this as a rebuild, this is something that we will be talking to the administration about next year. We knew that this year was hard with some of the projects that were ahead of Moccasin Bend, but this is something that I will tell you that the administration actually has gone out and looked at Moccasin Bend, both general services, Chief Ely, when he was serving as chief and now as F&A commissioner. So this is something that we will be looking at to bring back to the body.
Do we have an estimate on that expenditure? I mean, I know that construction costs are rising as we speak. So
Yeah.
today's estimate, we won't hold you to that for next year.
We
but-
do have an estimate, and I'm going to ask either Ty or Jean if they can recall what that estimate is. It was updated.
Gene Wood, I'm the budget director. The last estimate we had was in the $160 million range, and it kept increasing, so I don't know what it would be today.
And is that for replacement, remodel, or?
Absolute replacement.
Complete replacement.
Okay. But that is an old number, as you said. Okay, one other question, then I'll quit being rude and get back to my members. But you have $17 million in your budget for, maintenance. How much deferred maintenance do you have, I guess, discounting Moccasin Bend, which we could say that's a deferred maintenance of a couple $100 million. But how much, in addition to that, will there be out there after this allocation?
Jean, do you have that number as well? Can we look that up and come back to you on
Certainly,
that?
you
Thank
can
you so
provide that
much.
at a later point.
All right.
Okay, back to my list, and again, I apologize, members,
That's
for
fine.
jumping in, but Leader Camper.
Thank you, Madam Chair. Thank you, Commissioner. Appreciate your presentation. Can we go back to the children's behavioral health
Yes, ma'am.
you spoke about? Last year, the budget included $7.5 million
Yes.
for children behavior health safety net. The department indicated that many children served through this program would retroactively,
Mhm.
retroactively enroll in TennCare, and that some of the funding from the safety net could be recovered by billing TennCare
Mhm.
for the services. How much have you been able to recover in this manner?
Thank you so much for asking that question. That project has gotten off to a really slow start because of the pandemic. So hiring staff at the local providers to do outreach to places where outreach has not been happening because either schools weren't open, daycares closed. This has been a really anomaly of a year. But for those that we have served, I believe the percentage is right around 33% at this point. I would really like to come back next year and have hopefully a better year and see what happens with that. But I think it's around 33%.
Okay, thank you. And so in this year,
Mhm.
there's an additional $6.5 million for health safety net that has been described as a focus on the children.
Yes, ma'am.
Which is great.
Mhm.
Now, is this an expansion
No.
or is this a new, just not an expansion from last year?
Not at all. And
Okay,
then we
this is-
tried to word it differently. It's to expand safety net type services for kids. I'll give you a couple of things that we're looking at. Many of you have heard in your districts that more kids are coming to emergency departments. We know that in order to stop and intervene well, if you had a staff person from a local community mental health center that was assigned to that emergency department, just like we've been doing on the adult side, that we really could get kids connected to care. That's one service that might be available through these funds. Another service that might be available through these funds is the school-based behavioral health liaisons.
Okay.
As you guys know, what you funded last year has allowed us to get one per county. We know one per county, especially in dense counties, is not enough. So the other thing that we would like to do is allow local education groups and schools and mental health centers to come together and say, do we need one more or two more or three more? So what we were envisioning is something that would be based on the need, but we're not going to expand the safety net because we have enough dollars for the uninsured for the treatment side. These are other safety net type services.
Uh,
Go ahead, Leader
Okay,
David.
thank you, Madam Chair. So you mentioned the school-based behavior health liaison.
Yes.
And so I saw that in your questionnaire,
Mhm.
you had about 7,500 that was actually served in 1920, and then you estimated about 12,000 in this last year's budget. And so in this current budget you're speaking of, you increased it to 20,000.
Mhm.
So what can you talk about the need for the additional liaisons that you
Absolutely.
spoke
There,
of, I guess?
absolutely. There's a huge need. I mean, we have heard from principals, we hear from parents that we need more staff that are qualified and trained that can connect kids, especially poor kids. Kids that are on private insurance, they have a different way to get into services. We're talking about poor kids who don't have a person to help intervene and do a complete assessment for them to help their family. And what we're so excited about this program is for the first time in this state for uninsured kids and their families, y'all have allowed funding that wraps around that whole family. You got the safety net for adults. If you recall, we served almost 40,000 adults last year through that. That means parents that are struggling can be better for their kids. We got safety net for kids, which means if a kid's got an issue, that local mental health provider can truly have staff hired to wrap around those people. But we do know based on the needs that one person per county is not enough. That's all I can tell you with that.
Thank you, Madam Chair.
Absolutely.
Leader Lamberth.
Commissioner, good to see you again, my friend.
Good to see you, sir.
Thank you so very much for your work. And for years, I've asked every single year since I got to the legislature, and you know where I'm going with this, the numbers for inpatient treatment. And I noticed in your budget presentation, again, you know, we're investing in inpatient treatment. And I just want to highlight a couple of things. I keep these pages on in a file that I can easily access just to look at this every now and again. And members, I think it's something we should all look at. In 2012, and I asked for these numbers in 13, and it was shortly after I was elected to the legislature. Opioids this is inpatient treatment for those that state dollars, taxpayer dollars go to folks that have went into inpatient treatment. Opioids, there was about 4,147 folks that went in to get inpatient treatment for addiction to opioids. Alcohol was just over 4,000. Marijuana was just over 2,000. Now, if you fast forward a couple of years, and I appreciate your office providing these numbers, unfortunately, in 2015, opioids were still on top, 4,200. Now, look, that's almost exactly like it was in 2012. So population went up, opioid, number of people that were going in for inpatient treatment had been about the same. Alcohol was actually down. It was at 3,700, and marijuana was about 1,600. Now, some of that was because that year they counted polysubstance abuse, but you can see, I mean, it stayed relatively steady. Commissioner, again, whatever comments you want to make on this, please do, but I just want to highlight this is why it's so needed, the budget that we're investing here. Let me tell you about 2020. So remember, in 2012, opioids, about 4,200 folks, inpatient treatment. You know, 2015, similar number, alcohol, marijuana, all three right there at the top. And 2020, 10,800 people went in for inpatient treatment to opioids. Almost 11,000 people, consistently 4,000 a year, and then all of a sudden 11,000 people for inpatient treatment. Marijuana jumped up to 6,700, went from literally 2,200, 1,600 to 6,700 for addiction to marijuana, went in for inpatient treatment. Methamphetamines has jumped from 2012 being 689. I didn't bother to mention that one a while ago. 689 people in 2012. Members and friends, methamphetamines were 6,600 people last year went into inpatient treatment for addiction to methamphetamines. It passed alcohol for the first time. And oh, by the way, don't let it off the hook because alcohol was at 6,500. Every single category went up. So this is a wise investment of our dollars. But I would ask you, Commissioner, please continue to keep us educated on ways that we can try to keep folks out of inpatient treatment and intervene on the front end, because the world's telling people just use whatever you want to. There's no ramifications. You're never going to get addicted to any of these, you know, substances. But obviously folks are going in for inpatient treatment in numbers like we have never seen before. So is there anything else that we can be doing to support your mission through this budget or through our policies that just top of mind, you know, is there anything else that we can do? Because these numbers are not sustainable. And especially those top three categories, they are going to result in folks dying, especially those that don't seek inpatient treatment. So Commissioner, what else can we do?
Well, one thing that y'all have done that, again, has totally benefited thousands of Tennesseans who got into treatment is the funding of the Tennessee Recovery Navigators. You've allowed us to put people in emergency departments. These are individuals that had 2 years or more of recovery. And I can tell you, when somebody talks to somebody that's in recovery and says, I've been where you've been, that goes so far. And I've gotten so many emails. I've talked to so many of our navigators that are giving back. That has really helped, and that's a unique program to this state that we're very proud of. The other program that was federally funded is the ROPES program, which does help people revive after an overdose to give them a second chance at life. We know that helps. And then finally, you spoke, Leader, about prevention. We have put funds every year into prevention coalitions across this state to try to work on the grassroots level about whatever's going on in that community related to what happens to be the drug of choice at that time. COVID has hit us hard because instead of addiction coming down, you saw it go up. many people have said, I just decided I would drink more, I would try this or I'd try that. It's been horrible. But for everything that y'all have funded, I can promise you that our providers in this state take those dollars and they implement them to the best of their ability. And I would just say, use our resources, the 24/7 red line number that we've got, Tennessee Red Line, call it, and we'll help people get the help they need. Thank you.
And just a follow-up to that, in the treatment figures, do we know what sort of relapse percentages? I mean, I know I have a friend whose child went through this, and it wasn't the first time or the second time or even the third inpatient treatment
Right.
that did the trick. So
Relapse varies from person to person, and I haven't been a clinician myself. What I know is so many factors go into relapse, and many times relapse can be part of recovery if the people around that individual, especially faith-based communities, don't shame or blame the individual and say, hey, you just got to get back up and try again. That's in the past. Your past doesn't define you. Today forward is what defines you. So on the relapse rates, there's all kinds of stuff national. There's stuff prevalence. I don't want to really give a number that's not based on Tennessee facts, and I don't have that with me right now. So if you would like us to look at that and get that back to you, we will.
yeah, if we could look at the rates, and also if we have people who are, multiple inpatient sessions, they're in or in recovery and then relapse enough that they have to be back. I know people fall off the wagon, if you will, and maybe they're able to get back up with the help without being inpatients again. But if we could just have some information on, are those numbers that the leader quoted, are those all first time, one time, or some of those repeats, if you will?
We'll get you the most accurate information we have.
Okay. And Chairman Crawford, I believe you had a follow-up on that?
Yeah, I just wanted, maybe the leader can provide a little bit more information about his statement there. The number one was the opioid issue. Does that include prescriptions and fentanyl and everything into that one lump sum?
Yes.
Thank you.
Next on the list, Representative Ogles.
Thank you, Madam Chairman. Commissioner, can you walk us through, just a point of concern? I know, like, if we were downtown Nashville and we were to see an abandoned child, we know, like, what would happen. The police would come, fire department, EMS, they would check on that child. When we talk about safety nets, but when we see, like, our citizens that are elderly, who are obviously struggling with mental illness, who are homeless on the street, whose job is that to kind of render aid or specifically reach out? There's one lady I know that wears, like, coats during the summer with bags over them. I know everybody on this committee has seen her a lot. Whose job is it to render assistance to that person? Thank you.
I so appreciate you asking that question. I started my career in Memphis 30 years ago as a homeless case manager funded through a federal grant called the PATH grant. It's our job. And I can tell you that about 3 months ago, I got a call from a citizen who knows me and said, there's a homeless woman that's out here at McDonald's and it's freezing. And I've gone by and she's there, and I've gone by and I fed her. Can you help? I said, absolutely. I called the Assistant Commissioner, Rob Cotterman, who's in our audience. He had the PATH case worker go out to that McDonald's. That woman got into treatment. That woman is doing better, because I actually asked Assistant Commissioner Cotterman about it not long ago. That's our job, and we have funds to do that through our local community partners. And again, I'm so glad you asked that. I know that job inside and out because I did it. So thank you.
Representative Shaw.
Thank you, Madam Chair. Good morning,
Good morning,
Commissioner.
sir.
Thank you for being here, and let me start. I kind of like to give people flowers while they live. Let me start by telling you how much I appreciate you working to remove the stigma of mental health. You've really done a great job, and I really appreciate that very much. You mentioned Western mental health, which is my little pet peeve, a little baby. Are you moving the new kitchen? Thank you for it. Or is that going to be in the new building, or is that going to be replaced in the old building where it is now?
That is such a great question. And I don't have whether it's in the new or the old. Heather, is it going to be in the new building or the old?
It just is, it's an old building, it's not a new building yet, it's just a replace what's there today.
All right. So it's going to be in the old building, but we're finally going to get a kitchen.
Okay. It's a new
there.
kitchen, but it's in the same building where it is now is what I'm asking.
Yes, sir.
Okay. What about the administration building there? I know it's on our registry, and I know that it's been in bad shape. Is it stabilized permanently, or will we have to do anything else to it to?
It's as stabilized as it can be. As you know, we went out with Department of General Services and Commissioner Branscombe and looked at that. And they put together some estimates. And those estimates, I cannot recall the actual number to do anything with that, but it is as stabilized as it can be for right now.
I guess my final question is, a comment is, that the old building where the kitchen is now, do you think it's going to last? Is it going to give us the longevity?
Yes, sir. We wouldn't have put it in there. Yes, sir.
Okay. Thank you. And thank
Thank
you,
you.
Madam Chair.
Yes.
Representative Sparks.
Thank you, Commissioner. I want to thank Zach Blair back there as well. The late Rod Bragg and I were on a little show with Channel 5 years ago talking about these things. And sadly, y'all lost him. That just shows the seriousness of mental health. I wanted to read you off a letter that about a year and a half ago, we put together a little mental health and town hall opioid crisis event at Parkway Baptist Church. Had about 110 people show up. But this was from Dr. Linda Gilbert. Sadly, she passed away last year. She was the school director. Great lady. But what she said, and this is her last email that she sent to me, just says the behaviors of our 6 to 9-year-olds are nothing like we've ever seen before. They are inordinately disruptive and aggressive. And while we are bringing all our resources into play, there's no place for these children to go and be assessed and be treated. What are you seeing with this? Any progress that we've made to deal with what, like I said, this was the last email she sent me before she passed away.
I want to say I got to meet her and talk with her before she passed away. We had an unbelievable meeting. I was just asking Matt if I had the right name, because sometimes I don't do well with names. She was so excited about the Children's Behavioral Health Safety Net, because she knew that if we could have services to uninsured kids, she said that mainly the insured kids, they were able to help get services. But it was uninsured kids and underinsured kids that they had a problem with. And she also, I want you to know, during the COVID pandemic with our hospital, she went and met Ty Thornton, our chief of staff, and gave us thermometers. We didn't have enough thermometers at the hospitals. And if you guys remember, they all were selling out. And so she literally met him on the side of the road before she died to give us that, to let us use them. I had the utmost respect for that woman. I am so sad that she's not with us anymore, but I can guarantee you she would say every investment you make for kids where we can treat and intervene early rather than later is a good investment. And I cannot impress upon you guys enough what you have done in this state to allow our providers to wrap around a family. And you think about it, poor kids. I mean, it allows the ability to move forward because you have funded that ability to get services to that kid and that family. So thank you for bringing her up.
Friday night, I want to just share with the committee. Friday night, I spent the night at Vanderbilt ER. A mother had called me and her daughter had passed away, overdosed, and probably spent about 4 hours over there. Pretty sad situation. That's the second time I've had kind of deal with those issues like that. But I appreciate Leader Lambert and the chair lady for their passion and conviction, because I think most lawmakers up here care. If they don't care, they need to. But thank you for what you and your staff do. Thank you.
Yes, sir. Thank you.
Representative Lynn.
Thank you. Thank you, Madam Chairman. Commissioner, I was just wondering, the numbers that Leader Lambert was reading, I'm looking through the materials and I can't find them, but I would love to look at those numbers too. And I'm wondering, there are people in our community who they don't have a substance abuse problem. They just have severe and pervasive mental illness. Do we have statistics on that population? And is that population increasing? Are they, I'm proportionally with the increase in population with our state, I mean, we can tell if it's outside of, the growth is greater than the growth of our state. But are those numbers increasing, or are we treating those folks better with treatment methods and so on?
Thank you so much for your question, and it's really good to see you.
Thank you.
Actually, if you take a look at these two slides, this is what is so interesting that we went over with you all. This slide that shows prevalence data on uninsured Tennesseans that have mental health issues, we literally, per this prevalence slide, we were off almost 5,000 of serving people. That's amazing. That's the gap. What we don't know, Representative, is whether or not the COVID impacts that we've seen of high anxiety, high depression, hopelessness, whether or not that's going to impact these prevalence data numbers and have them go higher. So it's a guess. We can't know that. And then, Representative, when you talked about the numbers that Leader Lambert has, what you'll see here is the total number served. The wrap-up total is the 19,851. And what I'm trying to point out to everyone is we still have a long way to go on the substance use side in this state. We're so close on the mental health side, but we have a long way to go on the substance use side.
Well, I think what it is my, I think it's displaying funny on my iPad.
Mine
so I'm
does
going to
that.
download the report and I'll take a look. So
Mine does that too.
I think it skipped a page or two. Thank you so much.
Absolutely.
Commissioner, and I have a follow-up question. You mentioned in your presentation that there was funding that is going to be utilized for 2 more recovery courts.
Yes, ma'am.
Can you remind us where those currently exist, and then tell us where the new ones are going to be?
Absolutely. Thank you so much. Morgan County is where the first residential recovery court was established through y'all's funds that you gave us. The second one is the Women's Residential Recovery Court, which is set to open this spring here in Nashville, and that's for women. What we're looking at is data to determine the best place to put the other 2. We've got to look at current numbers of where people are coming from that need recovery courts so that we can establish that residential court where the people are. We're thinking it may be East Tennessee and West Tennessee, but we have got to pull those numbers and see what's most recent to determine the best place to establish.
What is the timing on that? When do you expect those to be up and running?
As soon as we get the funding, we're going to put out an announcement of funding to the local communities. I can't tell you because it's going to depend on, are we going to rehab a site? Is there a site to rehab? Are they going to have to build on a site? So it's going to depend upon the project. It will depend upon what is going to happen to get the project up and going. You've got our word, though, that we do them as quickly as we can.
I don't have any doubt about that at all. Are there other questions from the committee? A recommendation from one of our members that you've heard many times before. I do, Commissioner, want to thank you and your staff and the folks that are represented by you today from your department. Again, it's been a trying year for everyone, but I don't know any impact that's been greater than mental health for all the reasons that we have, mentioned ad nauseum up here. And I, like you, am concerned about even as we sort of see the light at the end of this COVID tunnel, what kind of long-term impact we're going to be seeing from people who've been isolated for over a year, who've been in a highly anxious state, and how that is going to impact behaviors, and for particularly, I think, for our children. I really don't think we have a clear idea of what that kind of isolation for children who've been home and not in school and not out interacting, how that is going to play into their both their behavior and their social development. So I'm thinking that we're going to need you all more than ever, and we thank you for the work that you do. And thank you for
very
being
much.
here today.
Take care.
We will have just a short cleanup break, and next we will have in front of us Department of Intellectual and Developmental Disabilities. Commissioner Turner will be up next. All right, Commissioner, if you're ready, we will begin. Thank you for being here, and thank you for being prepared. I'll let the record show we're 5 minutes ahead of schedule. So if you can give us another 5, we might actually get time to, I don't know, take a short break
Get some
today.
extra coffee. Yes, ma'am. Thank you, Chair Lady, and good morning, committee. I certainly appreciate the privilege we have to be here. To my left, I'd like to introduce Deputy Commissioner Andy Kidd on my fiscal and administration side. And to my right is Deputy Commissioner Jordan Allen with our program operations team. What I'd like to do very quickly is kind of highlight the impact that COVID has had on our customers that we have the privilege to serve here in Tennessee. Obviously, there's been a significant impact on Tennesseans with intellectual and developmental disabilities. The Medicaid waiver services, federal regulations that allowed for homebound supports to be provided to persons supported. There's face-to-face support coordination visits that are currently being done remotely. We developed reporting process for COVID positive persons that are being supported and staff that are responsible for providing those services. And then in collaboration with TEMA, we've coordinated for PPE acquisitions and distribution products out to our providers. For testing our drive-through provider locations statewide specific for persons supported, we initiated that relatively early on. My clinical director, Dr. Bruce Davis, worked very closely with the Department of Health to create pop-up sites for drive-through locations for testing. We coordinated with the Department of Health and TEMA to administer those tests. So again, Commissioner Piercy and her team, along with TEMA, have been exceptional partners in helping us get the testing done. On telehealth, we implemented telehealth less than a month after the first positive test of COVID was discovered in Tennessee on April 11, 2020. And then to help with that, we distributed tablets to all of the community homes to ensure that telehealth as well as virtual visits for family and friends. Obviously, a big part of that story is it relates to persons supported being able to see family. And as you've heard in nursing homes and other challenges in the pandemic, we wanted to make sure that there was some normalcy for our population as they could visit with family and friends. Inside TEIS, Tennessee Early Intervention Services provided primarily through teleintervention right now. Obviously, we want to make sure that we're not only protecting those who serve inside TEIS, but the families and the children that we visit inside that program. The service coordination visits are being conducted remotely, and our center-based services are incrementally resuming in-person intervention services. This is an area that was extremely important to us. We wanted to make sure that those families that felt their child needed to receive services in an in-person setting because of the benefit of that, we started to incrementally figure out ways to resume that so those children can get back into service centers to provide services to them. Our vaccine response, one of the things that we're really proud of, Tennessee was the first state in the country to prioritize people with intellectual and developmental disabilities in its vaccination plan. We were extremely aggressive with the Department of Health on how that rollout needed to look and what we needed to do. And as a result of that, Tennessee became the first state to help prioritize persons supported into the 1A1 phase of the vaccination rollout in Tennessee. And then just a little bit of an offshoot of that, over the last 3 months inside our community-based homes, we have seen a significant decrease of almost 84% of persons supported and staff that have tested positive for COVID. So we're definitely moving towards the tail end of this, but we're obviously going to be extremely careful in what we do inside the disability community in the state of Tennessee. The death rate, unfortunately, for COVID has been 3.5 times as high as it has been for a traditional population, a traditional community. So we want to be very safe, but at the same time, we want to allow them to get back to the jobs, get back into the community, and continue to live the lives that they've envisioned for themselves. And then finally, DIDD connects weekly with our stakeholders. So we work very closely with our provider network. During commissioner office hours, they have a chance to pre-submit questions to me and my executive team, and we work with them to answer those questions and provide feedback and follow up for any of the items that might be of significant challenge to our private providers. And every week we generally have more than 500 people that are in attendance. So we've had a good turnout with that. With that being said, we'll move to the F&A portion of this, and I'll turn it over to my Deputy Commissioner, Andy Kidd.
Thanks, Commissioner. Again, Andy Kidd, Deputy Commissioner for DIDD. I'm going to go over a quick overview of the department's funding, starting with positions. As you can see on the slide, through fiscal year 18, 19, 20, we were right around the 1,450 to 1,500. In fiscal year 21, we jumped up to 1,779, but to be clear, that's the transfer of the Tennessee Early Intervention System from the Department of Education to DIDD, so those were not new positions. And then as you can see, for fiscal year 22, it's a decrease to 1,763. The next slide is our couple of things on here, which is the DIDD state, and that's the 49 million. So that's specific state appropriations for DIDD. And then the large amount is the waiver funding in TennCare, not in DIDD, which is the 731.7 million. The next slide is our recommended budget by program. I'm not going to go through each of these programs. I know the committee is very well aware of what we do in the department, but did want to highlight the administration, which has gone down from last year. Last year it was 3.8%. This year it's 3.5%. It's something that we take very seriously and look at every year to ensuring that the administration costs are correct in the department. Again, the total budget is $976.4 million. So the next slide we have is the fiscal year 22 cost increases. The first one is for the direct service professionals. This is to increase the hourly wage from $10 to $10.50. Over the last several fiscal years, we've been continually incrementally increasing that cost throughout the last few years, and that's from around $8, and now we're up to $10 the current fiscal year, and we're going to $10.50 for this future fiscal year. The next is our telehealth program. This is an expansion of our pilot project. We started in East Tennessee in the region, was very successful in our ICF homes, and we're actually going to expand that to Middle and West Tennessee using these funds. I'll actually have Jordan give a quick update on that for our telehealth program and the success there.
Good morning, members of the committee. Jordan Allen, Deputy Commissioner of Operations. So our telehealth services, as was indicated by Commissioner, it became apparent to us while we were already considering how telehealth may interact with our population. The onset of COVID greatly accelerated that. Telehealth services now are being utilized across all of our direct service orientations. So we have people, in fact, we have data that shows the prevention of emergency room visits and other benefits to that program that we would have discovered over the next 18 months or 2 years, but we now have discovered very rapidly because of the onset of COVID. At this point, that telehealth option has been extended to our entire community. So nearly 12,500 people across the state now have availability. We're doing training, consultation, and everything we can to get our community in the private area to utilize telehealth at the same rate that we've now demonstrated internally has benefit for the people that we support.
Thank you, Jordan. The next line item is Tennessee Believes, which is an increase in recurring funds for school grants. These are, as they are, grants for schools so that they can increase assistive technology, guidance counseling, things like that for folks with IDD that want to attend post-secondary education. The next line item is an increase in our enabling technology program. We currently have $500,000 in recurring. This will increase the program alignment director. This is a position just to head up our alignment for the ECF coming into DIDD. The next line item is actually in TennCare's budget. This is the employment and community first choices. We're receiving 300 new slots for folks for ECF. Again, that's in TennCare's budget, but did want to highlight that for the people we support. All right, and I'll go quickly through the cost reductions, but happy to answer any questions on these. We have vacant positions that we eliminated in our administrative line item. And then we also eliminated some operational grants and subsidies in our community services area. And then we reduced our bed capacity for the Harold Jordan Center, and that's, as you see, line item number 3 there. And then number 4 was around equity and then operational savings in the regional offices. And then the last page is our capital funding, and this is a Middle Tennessee Regional Office, and that's the essential maintenance. We were doing some roof replacements and then just general improvements throughout the campus. And with that, I'll turn it back over to Commissioner.
Thank you, Deputy Commissioner Kidd. Madam Chair Lady, that is our report for the budget, and you said try to give back 5 minutes. I'm going to take into use and give back some time for some questions.
We're going to give you all sorts of extra points for that. Thank you very much for a very concise report. We do have some questions, as you might imagine, because there's I think you know from previous experience, and your staff certainly would, this committee has taken a very deep interest in DIDD for some time. We continue to do that. I say it every year, so I'll say it again. These are truly our most vulnerable citizens, and they are those to whom we are called to care and to make sure that they are cared for. So we want to help I know that that's the goal of your department as well, and we want to make sure that we as a state are doing all that we can to support that effort in a way that makes financial sense for everybody, obviously. So with that, Chairman Baum.
Thank you, Madam Chair, and I'd like to welcome Commissioner Turner to our hearings. Folks in this room may not know, but Commissioner Turner and I were elected to the Rutherford County Commission together in 2010 and served 8 years together. And I can speak from personal experience. Brad cares a lot about children with disabilities and children in general. And so it's nice to know somebody that's such a good person and famous.
I don't know about the latter, but thank you for the kind words.
I've got two questions for you. The first one is on the Katie Beckett program. The state is providing about $27 million a year to help about 3,000 individuals. And I'm curious to know what the enrollment and application levels currently are. I think the last figures that I heard were that about 900 people had applied, about 400 people were in the process of being served. Are those current, or do you have updated numbers?
Yes, so they're a little bit higher now, right around 950, and I think have been shown interest, and 450 are actually enrolled in the program. And I'll defer to Deputy Commissioner Allen for that. But I also wanted to kind of touch on that, Representative Baum. I appreciate your kind comments and that question. One of the things that sometimes gets lost, and I know Chair Lady had mentioned, we want to do things in a fiscally responsible manner, and that's exactly how we operate inside the Katie Beckett program. But on a very personal level, and I know that this committee understands this, when you're dealing with families, we have had several folks that have reached out saying this program is literally going to save my marriage, or it's going to save my family. And those things you can't put a dollar amount on sometimes. And we always try to do that, but just knowing that this body and our department were able to work very closely with TennCare and with the governor's office in implementing a program such as the Katie Beckett waiver. I want you to know that not only is it serving Tennesseans, but it's also saving families in a very traditional manner where they feel like they're actually getting help and they're seeing government work for them. So we take great pride in that, and I hope the committee does as well. And I'll defer to Deputy Commissioner Allen on some more of those statistics.
The numbers are just a little bit higher, as Commissioner was indicating. As of this morning, we were at 947 processed enrollments and 456 that were actually enrolled. We're seeing a steady stream as we hoped we would. And with a new program, you never know exactly. We built it for a year while we were waiting CMS to say yes, but you never know exactly how the intake systems are going to work on the ground. And we've been very pleased. As Commissioner noted, we're maintaining community contact with stakeholders, moms and dads who have people already enrolled or who are going through the enrollment process and taking real-time feedback to make adjustments as kind of on the fly, and that's really benefited us to date. So I think we're pretty happy with the way it's rolled out thus far.
Vice Chairman Baum, one thing I might add to that we're working on also is, as we have the TEIS program established under our department, that's a natural segue for some of these parents and the children that are 3 that are eligible for TEIS to migrate onto the Katie Beckett waiver. So we're working through that right now, figuring out ways how to make it as seamless as possible for people who want to participate in the Katie Beckett waiver as they shift out from the TEIS program.
And thank you for your good work on that. My second question has to do with hazard pay. TennCare and your department have partnered together to provide hazard pay for DSP workers who are treating individuals who have COVID with disabilities. Do we have enough money to continue to do this into the, let's say, the 2021 calendar year?
Yeah, thank you for the question. Quick answer is no. We ran out of those funds around July of last year, so we paid that out. We had $500,000 that were allocated for the hazard pay. We started that, I believe, it was 18th, and it lasted through around July 24th. So we no longer have additional funds for hazard pay.
Would you have any approximation for how much money you'd need to cover or provide hazard pay throughout the 2021 year?
For the entire 21 fiscal year, it would be approximately $2.5 million.
Okay, thank you.
Yes, sir.
Thank you all for your good work.
Thank you.
Next on my list is Chairman Whitson, the father of Katie Beckett in Tennessee. So Chairman Whitson.
Thank you, Chair Lady, and good seeing you, Commissioner, and your team. I know y'all do so much for so many folks in our state, and those who really, y'all have really made a difference for so many, and I hear about it all the time, and it's greatly appreciated. And Chairman Bond kind of covered some of my question. I appreciate that. What I really like about what y'all did is you moved out early, even before we had federal approval on this, and that really made this a great success from the start. And I think we were all surprised how quick that federal approval came in. But has there been any surprises or things that, as we move forward on this, or challenges that we're not aware of?
Yes, sir. And thank you, Chairman Whitson, for the comment and the question. One of the things that we do is I meet every week with our Katie Beckett team. And the core of that meeting for me is figuring out how do we get government out of the way and allow services to be delivered directly to the consumer. The things that we run into, are there questions about the application process? Are there misunderstandings about eligibility? If there are, is that something we did, or is that something that we need to work with TennCare or even with CMS on creating a system that's much more easy to be able to be navigated, and requirements and things like that we might be able to include so more Tennesseans are going to find themselves eligible for the program. So I think that's probably at the core and the heart of your question is, what are we learning from that? And every week we try to take away something from that to say, but what's working and what's not working. One of the things for me that I've established as a goal for myself is figuring out how do we get the approval process to move even quicker. Deputy Commissioner Allen and his team, led by Bo Hickman, have done a phenomenal job on implementing the program across the state, working. Families are aware of it, and not just are they aware of it, but services to start sooner than the families might even need them, because that's been one of the challenges we've run into. There's been delays, either they're receiving the PayFlex card or they've got questions about their application. So I'll pivot to Jordan in a second, but I wanted you to know kind of how my office was seeing things. We've got to figure out ways to continue to increase efficiencies and make sure that the services are getting to those families inside Tennessee that need it as fast as possible, and not allow any type of red tape or some sort of bureaucratic mess prevent families from getting services. And that's what we're committed to do. So I'll pivot to Jordan if he's got anything to add to that.
The only supplement I would provide is, as you're aware, on the front end, we pulled together a technical advisory committee, and this was physicians with specialty in providing care for children with intellectual and developmental disabilities, advocacy community, provider agencies. So that committee helped us and TennCare develop the level of care criteria. We're meeting with them again the week after next, and do so incrementally. This will be the first meeting post-implementation to do just what you're talking about. Let's talk about how things have gone. Let's talk about where adjustments might be able to be made. The feedback that Commissioner Turner referenced is ongoing, and families, as they reach out, is ongoing. This is more technical advice from the clinical community as to what they're seeing on the ground after implementation. So that's the only supplement. Thank you.
Thank you. And, as we look back at the Katie Beckett waiver process, it was a team effort with the disability community, your team, TennCare, and my fellow members of the General Assembly. We could not have done that without that synergistic approach. And I think that should be the model when we take on these big projects in the future. Thank you.
Yes, sir.
Chairman.
Thank you.
Representative Garrett.
Thank you, Mr. Chairman. Thank you for being here. One quick privileged commissioner. I had a constituent matter come up last week, and I'm so glad to see your staff, Ashley, with you all. I don't know if you live in my district or not, but her husband Brock helps me in my Gillisville baseball. He's an umpire in Gillisville baseball. So I'm so glad she's here today, and so glad to see you. And I had a mother in my district that didn't know something about her daughter. One quick call to Tyler, and actually your chief of staff called me on Saturday, and we were able to quickly get that resolved. So thank you very much for your staff that you have. That was an excellent conclusion to a little bit of craziness for my constituents. So I'm glad you were able to help her and her daughter and get answers to her promptly. So thank you. Yes, sir. For that. One thing I wanted to mention in my question was the Harold Jordan Center. I noticed you had about a $900,000 reduction in that facility. And my understanding of that facility is it provides some intensive care for those residents that are part of that program. And so I wanted to make sure, or at least ask impact that that budget will do, or that amount, that 100,000 will do for you, and the services that you offer for or in that facility, and then how many beds typically are filled for that, then I know will have an impact. Since I believe you're reducing the beds there. So if
Yes,
you could
sir.
elaborate, that'd be great. Thank you
Certainly.
very much.
Two things. Thank you for your kind comments. Ashley's been great for us. So it's probably odd when you see a familiar face come in like that, but she's been a great addition to our team. Second part of that, before I pivot to Deputy Commissioner Allen Kidd on your question about Harold Jordan Center, this is another thing that I'm very proud of that our department does in conjunction with the legislature. It's really the only facility like this in the country that provides these type of really deep services to Tennesseans that desperately need it. And one of the things is figure out areas of efficiency. So what does that look like, whether it's making sure that we're being good fiscal stewards or whether we're increasing services and the need over there. So what we're doing is we're always looking at that, very similar to what Chairman Whitson just asked, is what are you learning from that? We don't believe in being stagnant without observing and figuring out best case scenarios and how to continue to improve efficiencies and increase services for Tennesseans. So there is going to be a little bit of an impact, but I'll let Deputy Commissioner Allen kind of go into more detail around the Harold Jordan Center. Hopefully we'll answer your question.
All right. Thank you.
Yes, sir.
So very quickly, sir, the decommissioning of those 4 beds, if you're looking at it from a spacing perspective, they're in a different building separated from the Harold Jordan Center in its total. And so we developed those beds originally, as you know, sometimes when we bring people in for enrollment there, they're in crisis. Frequently that's psychiatric crisis, behavioral crisis. And so the development of that adjoined but off-site 4 beds was to be able to stabilize people in a more clinically intensive environment. So what we did as a result of the decommissioning is kind of reconfigure. In short, I can tell you in the committee that it will have virtually no impact on our programming there. And from a census perspective, we certainly don't anticipate that the decommissioning of those 4 beds is going to lead to people not being able to be admitted when they need to be. So I think it was a prudent move for us financially. Certainly, you know, in the economic crisis that accompanied the COVID crisis, it seemed like the most logical way to maneuver, at least for that center. And we don't anticipate any ill effect.
Thank you very much for that.
Yes, sir.
Thank you.
Yes, sir.
Representative Sexton.
Thank you, Chairman. Thank you, Commissioner Turner. My question is about the DIDD's waiver attrition. In recent years, the TennCare budget has included a reduction each year to recognize the DIDD's waiver attrition. As these participants in the closed waiver program leave the program, funding is generally moved to the ECF's choice program in TennCare. Last year, the reduction was $8.7 million, and the year before that, it was $9.3. There's no reduction for waiver attrition this year, and I just wanted to know if that attrition has stopped.
Yeah, that's a great question. This year, we actually saw an increase in waiver utilization, which is used of those that are attritioning out of our program. Typically, the utilization is level. This year, we saw an increase. And so the amount that we typically would have reverted back or sent back due to attrition was actually absorbed by the utilization cost itself. So individuals utilizing more services than they have in years past.
Thank you.
Yes, sir.
Next on the list, Chairman Todd.
Thank you, Chair Lady. Again.
Yes, sir.
I wanted to ask you about some of the residential homes that your agency has. Do you have several now, I understand, that are not occupied?
Sir, we have a total of 37 homes. Current census right now is, I believe, at 138. So we do have, we have a total capacity for 148 beds. 138 are filled currently. So the homes are configured in four-person units. We don't have any homes that are completely vacant, but we do have beds that are vacant across the state in those homes.
Okay, thank you.
Yes, sir.
We kind of had the impression there may be some that were being looked at to be sold. And I didn't know if that was accurate, first of all, and if it was, then, what the reason was.
Sure. Yeah, that's why I looked at you a little perplexed, because I knew what our census number was. So apologies for that. But we're pretty close to capacity.
Okay. Do you have a rough idea what the upkeep is? Is there an average price for one of these homes, what the yearly maintenance and upkeep would be on it? If you don't, that's okay. I know that's a kind of a real down in the weeds number.
Yeah, I don't have that in front of me. We obviously have that number, just not in front of me. I'll
Okay.
get that to you if you'd
If you
like.
could, that would be great.
Absolutely.
Thanks, sir. Thank you, Chairman.
A follow-up to Chairman Todd's question. I apologize, I had to step out, but aren't there some DIDD properties, not group homes, but other properties that are not being utilized and we're looking at repurposing or whatever? Can you speak to that?
Yeah, we can, I think Deputy Commissioner Kidd, can I speak to that? So I think of some of what you might be referencing are some of the old institutions that are now our regional. We still have Green Valley property, Arlington property, and the Middle Tennessee Regional Office property that are currently housing our employees. And I'll let Deputy Commissioner Kidd talk a little bit more.
Absolutely. So we do have some cottages specifically at the Clover Bottom campus that are being used by other state departments, specifically DCS. And then I believe Commerce and Insurance just looked at some of those cottages as well here recently.
And then I'm sure we'll hear more about the Green Valley at that point. But again, next on the list, Representative Shaw.
Thank you, Madam Chair. And thank you, Commissioner. I do thank you for your work. And basically just to comment, because I serve on CMRA board. I'm also interested in the residential homes. And I understand in some areas, you contract with people on the residential homes. Is that accurate? I'm not sure.
Deputy Commissioner Kidd could probably give a better answer than I can on the specifics.
Actually, I'll defer to Jordan on that one. Sorry.
Yes, sir. We contract with a private provider network, and they're serving directly roughly 7,200 people in the DIDD waivers. And then on the choices side, which is the other side of programming, they do the same, but those contracts are effectuated through each of the 3 managed care organizations. But those are private providers supporting via contract.
Well, I do want to thank you for the 50 cents. I remember way back when we started, it was, I don't know what it was, but it was certainly just chump change. So I thank you for that because, these people are really vulnerable and we have to speak for them. And most of all, they do quality work, good quality work. So thank you so much for that.
Yes, sir. Any chance that I get to publicly thank our DSPs, and Chair Lady Hazel, you had mentioned it earlier, they support the most vulnerable Tennesseans. There's by any definition, our population fits into that. They become their family, they become their friends, they're their encourager. And the idea that DSPs, everything we can do to try to help them, we certainly want to make sure that we do that because of the investment they're making in our population. And you know this, and Representative Sparks and others know this. My daughter has intellectual developmental disability. This is very personal to me.
Yeah.
This is not something that I just cash a check on. This is my life, and I'm built around this because of how her life has impacted mine. It's created an innate passion in me to make sure that we're providing services to other Tennesseans. And I challenge everyone when I go out, and I'll challenge the committee the same way, are you looking at these individuals through the eyes of God or through the eyes of man? Because if you look at them through the eyes of God, you see them differently. And DSPs are the hand and feet of that type of service. And I'm extremely proud of our network, and they do quality work. And as Deputy Commissioner Allen just alluded to, we have a really strong private provider network that we work very closely with. And I'm not here to try to take credit. I'm here to try to make sure Tennesseans live a better tomorrow than they are today with disabilities. That's it for me. And if it requires us to keep going to bat for these folks, we're going to keep swinging.
Well,
So
I really
thank you for
enjoy
your
the work
comments.
on the board. Thank you
Yes,
so
sir.
much.
Thank you.
Thank you.
And I would just add to that, Commissioner, I'm really pleased to see the 1050 recurring in the budget, but at the same time, I think we all recognize that it's still well below any kind of living wage, and it's these folks who are providing all of the things that you mentioned, intimate physical care, encouragement, support. They are being family to these individuals, and they could make more money at many fast food restaurants right now. We all are seeing, you walk into anyone or drive by, depending on whether or not you're allowed to walk in, but they all have help wanted signs, and I've seen some that are paying $15 an hour. So we have a ways to go, and that is something that I've been here 6 years. I've been working on it. I think we were at 750 or 8 when I started. So we're making progress, but I'm not going to be here another long period of time. I'm getting old, so I'd like to see this move a bit faster, and it's something that I would hope that this committee would help me work on to make that happen. So off of my soapbox, Chairman Hawk.
Thank you, Madam Chair and Commissioner and team. Thank you so much for what you do. I want to personally thank you for your responsive nature to the Katie Beckett waiver, as we heard from some stakeholders about concerns of navigating the system and the process. And thank you for what you did to roll out an easier process. So I appreciate
Yes, sir.
that.
Thank
So
you.
and very responsive from Tyler. Thank you very much as well. I'll eventually get to Green Valley, but I do want to. I do want to talk a little bit about with the chair lady's discretion. So, and we're talking a lot about providers and the direct service providers that we've got. We're hearing a lot from our constituents who are those providers that there's a crisis just around the corner, and you don't know you're in a provider crisis until you're in a provider crisis. And I have great concern that's occurring. As we're looking at the integration that's coming between ourselves and TennCare, DIDD, and TennCare coming up, there is some concern that there is some language that could hurt providers even more. I know one of our members, chairman of subcommittee, has a piece of legislation that would clarify some language. Can you all address that if you don't mind?
Yeah, and I'll let Deputy Commissioner Allen do that. And again, I want to thank you, Chairman Hawk, for your support in what we've done. And again, give a special mention to TennCare and others as we're working to try to create through that integration. I want to be clear on one of those things, that we're always going to work to make sure that we're providing the right services for Tennesseans that need it. And that's working very closely with our provider network. And we're continuing to do that. And we're going to continue to do that. And I'll let Deputy Commissioner Allen kind of speak to your question and comments.
Good morning, Chairman Hawk. So a couple of things. First and foremost, with the legislation that you're referencing, and I believe it's the bill sponsored by Senator Massey, it's some discussion relative to the development and implementation of policy in an aligned environment. So a couple of points that I want to make quickly about that. As we moved into the alignment phase, as we started to kind of vet that concept, we certainly asked for input from our provider network, as Commissioner Turner referenced. We're in, fairly constant, almost consistent communication with them. But this concept in and of itself was new to us and new to them, and it's happened over a relatively short amount of time. For those of you on the committee that have watched new waivers be born and implemented, you know that we're kind of doing this on an express time frame. Now, I don't want that to underscore the fact that we haven't done this in a very, very thoughtful way. Providers came to us and said, here are some foundational things that we absolutely have to see in an aligned system. The approach to align is designed to eliminate redundancy, to increase efficiency, and hopefully to allow us to better spend the very limited number of dollars we have to provide care to this growing population. As you referenced, the crisis around the corner in some ways has been on the horizon for some time as deinstitutionalization has taken hold and folks with disabilities are now living in our neighborhoods and communities. What that means is that the strain on the community provider becomes spread out, and if we're not careful, that we're aligning policy to their efficiencies, if we're not careful, that we're considering the impact on providers as those numbers grow and grow, then indeed we could find ourselves in a tough place as the number of people needing supports potentially outgrows the number of providers available to provide those supports. So the three things primarily that they told us up front that we could do in this alignment that would dramatically increase their efficiency are align the way they bill. And without boring this committee, I'll tell you that their thought was, right now we're billing in 4 separate ways, 3 MCOs in the department. And so every time we bill for one service, the potential is that we have to figure out which of those 4 systems it is. And so we aligned that, or plan to align that on 7-1 into a single billing system. So if you're a provider, it doesn't matter what service you're in, you bill it in the same way. We, TennCare, and the managed care organizations process that claim. The second thing was credentialing requirements. So provider agencies said to us, we don't want to credential with 4 different agencies, 3 MCOs and the department. And that means when I enroll as a new provider, I don't want to have to go to 4 different people and show them the same stuff, or annually when we re-credential, we don't want to have different requirements for one than the other. So they asked us to develop and implement a single credentialing approach, which the department is doing right now and will on 7/1 be the unified credentialing source. So that'll create a tremendous amount of efficiency for the network also. The final thing is planning. And as you're very well aware, we've had conversations about how the individual support plans for people ultimately drive their services, and the development of that plan is the root of what they can achieve individually on their own. And what providers told us is we don't want to do that multiple times either. We need the best approach, which we've identified. Thankfully, the department in our accreditation with the Council on Quality Leadership has developed and consulted on a single ISP or individual support plan process, and we'll implement that on the 1st of July also, again, which will unify the way we plan and unify the way people request services, which we hope, one, brings them better service, which we believe it will, but certainly it will increase efficiency for that network. So overall, the things that they've come to us and said, these are the things we got to get out of the way right at the beginning. We feel like we're on track to be able to implement those on the 1st of July. And then we will continue that back and forth conversation with them on other things that we can attack thereafter, ultimately with the goal of making their administrative burden as light as possible in hopes that people receiving services then benefit more time and attention from that agency.
Thank you, Madam Chair, and thank you very much, Jordan. I appreciate that. That's a great response to the question, and for our providers to hear that, it's very good. So I really appreciate that. I will go down the road to Green Valley and now, and Commissioner, we've visited together on campus there several times, and Green Valley has become a COVID response site, working with our Department of Health, and has been invaluable to our community and our region as folks have been helped in that regard. Additionally, we've been a potential COVID overrun site, or for lack of a better word, if COVID becomes too large for hospitals to handle, we've been able to, or we've saved some space there as well. One of the electronic homes, for lack of a better word, fully integrated home there has been interesting to view that as well. I say all that to say I'm wondering what the future uses of Green Valley will be. As we heard Department of Mental Health and Substance Abuse Services speak before you, there's great need in terms of facilities and uses. I just want us to keep an open mind should some, whether it be another state provider or an outside provider, come to us and say, hey, we could use the existing structures, the existing facilities on campus at Green Valley to just have that open mind. I put that out there, and the question is there a master plan, a 2-year master plan, 4-year master plan for Green Valley in particular, but the other structures that the state owns?
Yes, sir. Thank you, Chairman Hawk, for the question. Your comment is actually perfectly timed. We're meeting this week, I think, with DGS to have those discussions. And we were actually at Green Valley last Monday, and we went through the buildings, and we're looking to figure out, okay, what do we do that's appropriate? So, to your point about the question, we want to make sure that we're being good partners with you and the community. That's the bottom line for us, is figuring out ways to help Greene County and that area and whatever that might look like. So I can commit to you, I can't commit to what it's going to look like, but I can commit to you that we're going to do the best we can to make sure that we're being good partners and good stewards of that property, whether it's a private investment or whether it's something with the state. But we are meeting this week with General Services, and Green Valley is a big part of that conversation.
Thank you, Commissioner.
Yes,
Thank you,
sir.
Madam Chair.
Leader Camper.
Thank you, Madam Chair. Thank you for your service.
Yes, ma'am. Thank you.
Question about your reversions. If you look at one of the questions in your questionnaire package, it says that the department reversion target for FY 18-19 was 300,000, but you reverted about 7.4 million. Can you explain that?
Yes, ma'am.
Thank you.
Sure.
Yes, ma'am. Thank you for the question. The standard reversion target is given to us by Finance and Administration, and that's the $300,000 that you see there. The reversion that you see historically was, as one of the other representatives pointed out, was the waiver attrition dollars that were not spent as those folks attritioning out of the program. So that typically that's what that dollar amount is.
Okay, thank you. Thank you, Madam Chair.
Yes, ma'am.
Thank you. Are there other questions? Oh, I'm sorry, Representative Sparks.
Thank you, Commissioner Turner.
Yes, sir.
Glad to see you. I always appreciate people with passion and conviction, and you live this every day with your daughter, and I appreciate, what you've seen and how you can empathize with others. When I'm going to leave this committee about 12:30 to go see my sister that's in a nursing home. My sister Vicky, she had a bad fall, and first time I'll be able to see her in person in a year due to COVID. But want to thank you and Vice Chair Baum for the all-inclusive playground in my Smyrna Rotary Club. Mike Moss and Brian Hercules, our town manager, and Mayor Reed. Do you think that park will be utilized a lot? And what's your prediction as far as people in Middle Tennessee that will use that as the radius maybe?
Yes, sir. I mean, it'll have pretty far tentacles, Representative Sparks. A lot of those areas, you don't have a lot of that. And so anytime you have adaptations that are made to playgrounds, you're going to see a lot of that. And that's really at the core of what we're wanting to do in our mission and vision inside our department is create more independence and less dependency on our department. My job, and I say this kind of tongue in cheek, but I'm serious, is we want to work ourselves out of a job where our department's no longer needed because there's been a full integration in the community. And a big part of this integration that Deputy Commissioner Allen was talking about is employment and creating job opportunities for our population. So as you have more of these community type focused projects, it expands naturally into areas that we care about. Tennessee believes employment, education, integration into communities, because if you think about it, and I think everyone on this committee knows, we're only 6 or 7 years away from when our population was housed in institutions. That is wholly immoral and was not acceptable for us. And thank you, Philly, my predecessor, Commissioner Payne, worked very hard to get us through and navigate through those lawsuits. And now we're able to start figuring out what does a fully integrated community look like for Tennesseans with disabilities. Those types of projects, and not only Smyrna, but Miracle Park and Murfreesboro that you're familiar with and others, are going to be important because it creates a natural circumstance. Because what you see now is children are playing with other children with disabilities, and God bless them, they don't see that.
Yeah.
All they see is another kid on the playground. That's the kind of culture and community that we're wanting to create, and those types of projects will help facilitate that natural transition into acceptance of who a person is and not what they look like.
Yes, thank you.
Yes, sir.
Just to tag on to that, I'm very proud to be a part of the Downtown Chattanooga Rotary Club. And we built a miracle field in Chattanooga. And prior to COVID, it got a whole lot of use, and hopefully it will be soon again. One quick question. I think there, and again, I've had to be in and out, and I apologize for that. But you mentioned in your presentation, Commissioner, the the significant increase, I think 3 or 4 times as many of this population succumbed to COVID as the population in general. I know, Orange Grove is not in my district, but it serves clients that are in my district. And I know of DSP workers who, regardless of the COVID crisis and regardless of the fact that some of their clients had COVID, they chose to stay and continue to work and care for them. Do we have any statistics on those workers in terms of their outcomes, COVID-related outcomes?
I can't speak to those outcomes specifically. We do have record of those that were DSPs that would have tested positive inside our service network. But as far as outcomes or impacts on what the mortality rate would look like, Chair Lady, I do not have that information.
Again, I think it just serves to underscore what we mentioned earlier, the dedication of these folks. We don't pay them enough. It's not a job, it's a calling. If it was not a calling, they wouldn't last long, because it's a tough, it's emotionally, physically draining and stressful. So again, I just want to thank the people across the state who provide that care to Tennessee's most vulnerable, and to reiterate that we're going to do the best we can as a committee to make sure that we're never going to be able to adequately pay. There's not enough money in the world to do that, but hopefully we can increase the pay to something that, because I know too many DSPs who are working 2 jobs just to buy groceries and pay rent. So I said I'd get off my soapbox, but I have a real hard time staying off. So excuse me for that. Anyway, we thank you again for the work that you do.
Thank you.
For that population. I know for you, it's personal. For many of us, we have personal stories. I've shared with you, had an uncle that my mom cared for 25 years in her home, because there wasn't this kind of capability. And, luckily for my uncle, my mom was there and willing and able to do it. But not everybody has that kind of family support. And we owe it to those citizens to make sure that they're cared for. And thank you to all of you and to the people that you represent in your department, and to the DSPs and all of the facilities across the state, like Orange Grove and Chattanooga, that are just an integral part of this process. We couldn't do it without them. So
yes, ma'am.
thank you.
I want to, all of the folks that work inside my department have a calling. And I'm very fortunate that they accept me as the weak link, and they keep the chain strong anyways. But I've got the best department in state government. I'm very proud of what we do. Not only is it mission driven, but it's very personal and passionate to a number of people that work inside our department. And it's just a blessing that I thank the Lord for every day that I get the privilege to call myself the commissioner of the department. So thank you for your kind words.
And we're very blessed as a state that you do that as well. So thank you for your leadership. Thank you guys for being here. We'll take a short break for cleanup, and then I'm told we're a bit ahead of schedule, but our representatives from F&A are on their way down from the Capitol to join us.
An hour and a half lunch break. Is that what you said?
Yeah, we're shooting for 15 minutes.
All right. I'll take it.
Well, Commissioner, thank you for hurrying down. This almost never happens in this committee, but we're actually running a bit ahead of schedule, and well, some of us go directly from this marathon to Council on Pensions and Insurance. So if we could grab 15 minutes to cram down some food, we would all be delighted. So thank you for helping us maybe work toward that goal. And I know, Commissioner, you presented to this committee right up in the beginning the overall budget for the state of Tennessee, the proposed budget. But today we're looking at the budget for your department of F&A. So if you want to just talk us through that, we're ready to listen.
Very good. Thank you. Good morning, Madam Chair and members of the committee. Thank you for the opportunity to present our FY22 budget proposal for the Department of Finance and Administration. I am Butch Ely and have the opportunity to serve as Commissioner of F&A and appreciate that. I'll set the table real quick with the others here at the desk. With me, Eugene Newbert, our F&A Commissioner, Deputy Commissioner. Valencia Hill is with me here. Our Controller, Stephanie Dedman, to my left. Our Chief Information Officer, and Christine Lotz over there is our Director of Office and Impact. Like all of you, I know we will never forget the events of just over a year ago. We all awoke to devastation across our state due to the tornado, and just 2 days later experienced our first COVID case in Tennessee. And our job at F&A is really to serve all of our other departments in the state, and in turn serve the citizens of Tennessee. And this is our mission here that you have before you. We have 2,000 very dedicated professionals that live and breathe this mission day in, day out. As you know, F&A has 6 divisions, and one of the ones that we've had a lot of discussion about is our Strategic Technology Solutions, better known as STS, our Division of Accounts, Benefits Administration, which oversees the state's health and wellness plans, our Division of Administration, which does a number of things, which includes our Fiscal Office, our criminal justice programs, and more. Our Division of Budgets, which is probably our division that we have the most connection with or contact with this group, and also the Office of Inspector General, which, as you know, investigates fraud of the TennCare program. 2020 was a difficult year for everyone, and these are some of the faces of the services that F&A provides during the pandemic that really helped to get our people back to work during this. STS purchased, prepared, and deployed literally thousands of laptops. We expanded bandwidth in every area, and we continue to work and provide agencies with what they need to be able to change and adapt to the environment that we're in today. As I would be remiss if I didn't at least mention the extraordinary accounting that is not usually noticed. As you know, we saw such an unprecedented influx of federal funds during 2020, and we have the distinction in Tennessee of being the best fiscally managed state. And really that is for 2 reasons. One, we have a history of working hand in hand with this body and this legislature to provide really sound budgets and good fiscal policy. And number 2, we have great people performing the tasks that need to be done. F&A, with the input of many at the Comptroller's office, produced this annual report for excellence in financial reporting from the Government Financial Officers Group for each of the last 40 years. And that is the most that any state received. Actually, we were able to produce this report this year, even a little ahead of schedule, even with the pandemic. And it's something you may be interested in. It's on the F&A website. You can take a look at it, or just call our office. We'll make sure that you get a copy of it, but it's worth taking a look at. Here's another resource that you may find useful. We were able to do this in the summer, acknowledging the huge influx that we did receive in federal funds, working with the speakers and several legislators through the FSAG group, which is, as you know, stands for Financial Stimulus Accountability Group. We wanted to be able to make sure that people were able to see where the dollars went in Tennessee. And this includes all the funds that were awarded to the state, the funds through the CRF that the FSAG group administered, as well as other funds that simply kind of pass through the state directly to individuals. But what this shows is really every dollar that's being tracked day in, day out. You can go to this and see every county and what the federal dollars that have flown, that have come into Tennessee. And this is on the F&A website as well. So now let's get to the budget. Our proposed budget in fiscal year 22 is just shy of $480 million, as you see here on the slide in the bottom right-hand corner. If you look at the spike that you notice in the fiscal year 2021, with the $216 million in federal funding, that's really a result of recognizing dollars coming in from the federal government due to coronavirus. We expect that to continue to increase through this year. And as you see, we have $63 million proposed this year in 22, but we certainly expect that that'll continue to increase as we go through this year. And I'll mention again later, but we'll be seeing that again through the committee, through expansion request as we go through the year. Next is the cost increases for F&A particularly, and all but 3 of these are in SDS and will be paid for by services supplied to departments and agencies. I'm just going to hit these at a high level. Internal facing, they really all are related to better serving Tennesseans. Our main responsibility at F&A through SDS is to be continually focusing on how we improve our IT services. And we certainly learned a lot this year about the changing environment of technology and what Tennesseans need to be able to support that. A lot of that revolves around data, how we get data, how we use data, and how we protect data, frankly, through cyber protection, and really how we bring all of those things together to be able to support our citizens. Tennesseans need faster and more reliable services from the government, and we want to provide that in both through STS and the Office of Evidence and Impact, who Stephanie and Kristen are with. We're increasing our data capabilities and our user experiences of all the platforms that people interface with throughout the state. I'm gonna pause there. Data analytics, citizen scheduling are some of the improvements that we have within this. I'm not going to go a matter of respect for your time, Madam Chair, but here to get into much more detail in any of these items that that you want to get more information on as we go into this today. Some of the increases that fall into the budget miscellaneous enterprise category, I want to at least touch on. One of those is process automation. You'll hear more about that, but it really just provides technology so departments can allow our employees to be able to delve into really higher value tasks. And so that's an important addition to this budget. The remainder of these that are the state use of technology are being paid for through agency budgets as it relates to those additional things. I'm now going to turn it over to Eugene and let him go through the high-level reductions, and then we'll answer any questions.
Thank you, Commissioner. So yes, as Commissioner mentioned, these are
And
our.
if you would just state your name and title for the record, please.
Yes, ma'am. I'm sorry. Eugene Newbert, Deputy Commissioner of Finance and Administration. These are our reductions for the fiscal 22 budget. We're proposing a little short of $18.3 million in total reductions. $272,000 of that is from state funds, and the reduction and elimination of 32 positions. The 32 positions were outlined last year. Most of these have already been reduced through the summer exercise of vacant positions. And these positions are across our budget division, STS, the Division of Accounts, and Inspector General. And this is just basically right-sizing the budget to our actual position count. The third-party contracts reduction you see involves moving to more efficient services. So as we looked through contractual services, we had contracts that were ending that we no longer needed, that we could eliminate from our budget, as well as services that we believed we could receive in a more efficient manner from providers that we already had on contract. So for one example, we have IT Academy. Some of you may have heard of that over the years. It's a training program for our STS staff. We're reducing the contract with the organization that provides that training because as an agency, we entered into a contract for all of our employees with LinkedIn Learning. That platform has thousands of training modules for everything from technical to soft skills, leadership skills. It also has IT technical training modules that our staff would be able to leverage. So it just made sense to use that tool that we were already paying for just in that manner. Additionally, the technology infrastructure efficiencies that STS has identified, shifting from physical servers to virtual servers, reducing spending on certain software. Of our payroll equity reduction, it's just simply aligning our payroll budget in the Division of Accounts from positions that I mentioned had previously been eliminated. Software or cell phone and software licenses in STS is a reduction of cell phone uses, of replacing WebEx with. Those are just some examples of the reductions that are a part of our budget. And then the positions, I would say, just highlight last year at this time, we had 2,207 positions with 106 positions. So a reduction of 101 positions, about 5% of our workforce. And that was done through that vacancy position as well as the reductions over the course of last summer.
So, Madam Chair, one thing that I prepared to do was to talk a little bit more about preparing for the future and what we're doing to do that through kind of more discussion of process automation, the cloud, and evidence base. But I want to make sure we have enough time for questions, and so I'll pause here. I can keep going through the next couple of slides, or I'll defer to you as to whether you want to go ahead and take questions.
Commissioner, why don't we take questions, and then if we have additional time, we'll come back. And I know that some of your folks are going to be in front of
Yes.
Chairman Williams. I'm looking at, I just promoted him, but in front of Chairman Williams' committee later, and we may
Later,
delve
yes.
into some of this there, just in the interest of
We will.
time. So,
Okay.
oh, sorry, can't find the right list. Representative Freeman.
Thank you, Madam Chair. Commissioner,
Yes.
thank you. Thanks for all you do for our state. I have a question. In the proposed budget, we see $653,000 and 4 positions for the office, or to establish the Office of Evidence and Impact. My understanding, this office would oversee evidence-based budgeting and coordinate some data sharing across agencies. Can you talk a little bit about the goal for implementing evidence-based budgeting and how it will change the way we currently do it?
Well, thank you for that question, Representative Freeman. I think that it's an important question and something that we really have been leaning into really the last couple of years since Governor Lee took office. And really, you know, it's not really rocket science. What we're trying to do is invest in what works. And so what we're trying to do is to get intentional about figuring out what programs we're providing has evidence based behind it. And what's working in other states? What can we demonstrate has that type of evidence behind it? When I went to grad school, we called it zero-based budgeting, starting from scratch and building up from there. But really, it's just about making sure that we're using the best information, the best data to make sure that that we're investing in what works. I'm gonna turn to Kristen real quick. She literally on the national scale now with a committee that is working on this on the national level. And so let me give her the floor to be able to give you a quick update.
Sure. And is this on?
Hit it, I think. Yeah.
Okay, sorry about that. Kristen Lotz, I'm the director of the Office of Evidence and Impact for FNA. Representative Commissioner Ely did a really great job of explaining sort of our high-level goals for this office and evidence-based budgeting in particular. If I could, the mission of our office, just quickly, is to better use data and evidence in both our policymaking and budgeting decisions to ensure the best outcomes for Tennesseans. And we do that in a number of ways. You mentioned our work with STS to encourage greater sharing of data between our departments and taking more of an enterprise level approach to data analytics. You'll note we do have an item in our budget for enterprise data analytics work so that we can continue to move forward in breaking down the silos that have been a part of our data situation. But when it comes to evidence-based budgeting, we are working with the departments to do a couple of things. We're working with them to create a program inventory where we are working with them to put together a list of all of the programs and services that comprise their base budget, and utilizing an evidence framework that we have established along with a number of experts in evidence and evaluation. We're assigning a level of evidence and evidence value for each of those. And so that's going to be a really helpful tool. In addition, we have created a tool for departments to use to help us understand the level of evidence, the level of data and research that supports the programs when they are either requesting a funding increase or also when they are submitting a reduction proposal for that program or service. So we're using this information to better inform our decision makers around, to Commissioner Ely's point, what do we know really works? What do we know really has the best outcome? So the goal of our office is to make sure that we have that data and that research available that supports the programs that we're investing in.
Yep, thank you. So last year, I believe there were 5 positions that were supposed to be funded there. They were taken out because of COVID. you've now come back with 4. Why the reduction? And then quickly, will the staff be dedicated solely to this office or to that office, to your office?
Let me take the first question, Representative Freeman. So last year we actually started this program the year before with kind of funds available to at least get the ball rolling to be able to try to lean into this. And we repurposed a position, I think, last year as a part of this, and therefore we didn't need to ask for all 5 of those positions again. But the 4 positions will be dedicated to this on a full-time basis. Of course, they'll be working kind of across the enterprise, working with departments to be able to help them and be a resource to them as well. So it really will be kind of an enterprise-wide benefit. Okay, thank you.
Thank you, Madam Chairman. Thank you, Commissioner, for being here. In last year's budget, there was about $5 million appropriate for recurring funding, 365 service migration. In this coming year's budget, there's an additional $1 million recurring cost for Microsoft Unified Command. Does the new Microsoft subscription come with this, and what exact benefits are being provided to the state?
That's a great question, Representative Gillespie. And I thought, Madam Chair, we may cover those future preparation things with the questions. And so this has given us a great opportunity to do that because that's a great question. I'm gonna let Stephanie answer your question, but also look at kind of a little bit more about the broader picture of our cloud migration and what we're doing there.
Sure. Thank you. Stephanie Dedman, Chief Information Officer within the Department of Finance and Administration. The additional funding request this year is because Microsoft has moved away from the current support model that they provide. I believe it's called Unified or Premier. I'm getting it backwards. But today we have dollars that if an agency needs particular help with a particular piece of Microsoft, we use those dollars. The new model, Microsoft charges us what for us would be $1 million, and it's based on our consumption, both from Office 365 as well as in the cloud, the Azure piece of the cloud. And so, and interestingly, I expressed dismay with this model when Microsoft first rolled it out because it is an ongoing cost for us. It becomes, more of an operational as opposed to when we need it. There are benefits, though. In fairness, it gives us the ability to lean on Microsoft when we need help for a particular product. If we need training for our individuals, we are able to use that unified support for those services. To Commissioner's point about cloud, just if I could take a little bit of a step to the right on that. So the cloud is something that's been around for a while. Most of you have heard us talk about, we have 2 state data centers where we invest in the infrastructure and the ongoing maintenance and upkeep of that infrastructure. Moving to the cloud will enable us really to outsource that, if you will, to a third party. And actually, we're implementing what we call a hybrid cloud model, which means we're not just going with one vendor. We have 2 partners at this time that we're working with to provide cloud services. So this will enable us over time to spend down one of our data centers so that we will minimize our infrastructure cost and spend the money with cloud partners. So we will be migrating our business applications to one of our 2 cloud partners over time and be able to reduce our data center footprint.
And if I might just follow up on that, on the Microsoft United, it's $1 million recurring.
That's correct.
Is that for unlimited support, or is there a cap on that?
It's unlimited in terms of as we need it. They provide support for everything, but it is unlimited.
So if we ask, they will come.
Yes, and I will add that I mentioned that it's based on consumption. So as we as we utilize more Microsoft products, that number could and will very likely go up. But it does give us the service commensurate with that product.
Thank you. Next on the list, Chairman Hicks.
Thank you, Chair Lady and Commissioner. It's certainly good to see you and your staff here. I'm waiting on you to find me. I know you will. There you go.
You're in your normal seat. I don't know.
I started to duck down just to see.
You're in your normal seat, so I don't know why it took me.
Well, I'll try to be brief. What I want to talk about and maybe get a little more clarification on is the state employee compensation. It looks like there was some funds reverted back in fiscal year 19 as well as fiscal year 20. And so can you help me just to maybe explain, because those reversions that are coming back, while it's not necessarily a bad thing, I'm just curious of why aren't we fully utilizing those monies that are being appropriated?
So is this an F&A particularly that you're talking about, right?
Yes.
Our reversions, yeah.
Yes.
Well, I'll start off and then let Eugene correct me if I get off base here. But basically, we're trying to be as efficient as possible, and we had a lot of I would say, last year with the pandemic, and as we moved into the hiring freeze, as we moved into those things, we really tried to pull back on every place we could to be able to be conservative and not expend funds that we didn't absolutely have to have. And so we probably were reverting reverting more because of that. Eugene, anything you want to add to that? Yeah.
No, sir. I think F&A has always tried to be conservative with the dollars that have been appropriated to us and be good stewards with those dollars. And so in certain years, there have been savings, and when there are savings, those funds do revert back.
Excuse me, what are your projected reversions for this year for the state employee compensation?
Specific to employee compensation, I don't know that I have those numbers. I think our target this year, correct me if I'm wrong, is $250,000, and we're projected to at least meet that.
Okay. So the numbers, I guess, let me just throw this out here, and then you can kind of help me try to get an idea. So fiscal year 19, total reversion, it looks like it was somewhere around 27 million. And then for fiscal year 20, it was somewhere around 13 million. So again, this was going for performance bonuses, salary increases, and also money for those market rate adjustments. So that's the monies that I'm actually talking about. It's just those reversions. Just curious why, I guess that's really my question. Why aren't we fully utilizing that? And I get being efficient. Totally understand that, but it's kind of what that fund is for.
So I think I understand your question, and I think that's a bigger question, and certainly bigger than just F&A's budget.
Yeah, I misspoke. I'm sorry. Yeah,
those
when
are the
commissioner asked me. Sorry about
that. And so I think I'd have to defer either to commissioner or as we look at. I think overall on the enterprises, we look at how we utilize those funds, especially I think fiscal year 20, as you referenced. I think there were some decisions made that because of, well, no, that was this year's when I'm sorry, I'm a year behind. So
I think it's the same answer. I think it's the same answer, Chairman. I think that we have built in the ability for departments to be able to utilize those funds when needed, whether, in certain cases, they use those funds for equity to be able to move around positions or hire people at certain positions. But, from my standpoint at F&A, we don't want them to just spend those dollars if they don't have to utilize those dollars. And sometimes when we kind of have a situation where we need to be cautious, then we'd like them to hold back on being able to do that. And so, so in those cases, they're there, they make the case and need those dollars, and they can justify those dollars. But, in this case, they have not.
Okay. All right. Thank you very much. Thank you, Commissioner.
Yeah, thank you, sir.
Chairman Zachary.
Thank you, Madam Chair, Commissioner. Still morning. Good morning. Thank you to you and your team for being here. Quick question related to cell phones and software licenses. The budget includes almost $500,000 in deductions for expenditures related to software and state cell phones issued, but yet there's also an increase for $3.6 million related to contracts. Can you explain that, please?
Yeah. Well, I'm going to give a general, and I expected this because I know that you're pretty familiar with this subject. And so I'll let these guys that may know more about it than I do, but basically on the reductions, we were looking at areas where we could pull back services that didn't have a negative impact, and we're able to do some things that we're able to do that with small amounts. But in the areas of the increases, there were things that we're looking toward to be able to really start accomplishing what we need to be able to do enterprise-wide to be able to invest. And so that's the reason kind of for the offset. We would have come with the increase, I think regardless, but to be able to really get us where we need to be able to go in the future. You want to add to that, Stephanie?
Yes, I believe that the cell phone decrease is specific to FNA, where we identified employees that no longer would need a state cell phone for whatever reason. And then the increase is at the enterprise level. Our mobility contract was up for renewal, so we did a reprocurement and decided to go with a multi-vendor model, which we don't currently use AT&T cell phones, but we do have two providers. So had we had AT&T, we have a backup, and the ability to quickly get phones from another vendor. And so in the process of rebidding it, the cost have gone up for mobility services, and so that's the increase.
Thank you, Madam Chair. One more. And just Stephanie, a quick question for you. How dependent is the state's network on AWS?
The network, assuming you're referring to Amazon?
Yes, ma'am.
Yeah, we're not dependent on the network. We are moving some of our business applications to Amazon's cloud, but we would still have, so eventually there would be some reliance, but because we're going with a multi-vendor cloud model, we would be able to quickly, and that's one of the benefits of the cloud as well, is it's very agile, and Representative Zachary, you know that, but very agile. We can move compute back and forth, not that we would just do that willy-nilly, but for cost benefit or in the event of a emergency or a situation, of our compute back and forth. We will continue to maintain our state network that's currently with AT&T. It is there is a future rebid on that, just like most of our contracts.
Okay,
And
thank you.
let me just add quickly to that, because I think this is the point you're making. We want to reduce our total dependability on any one vendor, and so on Christmas, where we had some negative experience, but it's a direction that we were already headed before that, and it's a direction we need to continue to go to make sure that we're not dependent on any one source, and that we've got the ability to function regardless. So that's the ultimate goal we're trying to head to.
Thank you. Thank you, Madam Chair.
Chairman Williams.
Just under the time slot there. Ms. Dedman, I had a quick question for you on the budget documents that we got, page B18, B23. It talks about a citizen scheduling application system. I think that we did an RFP for, or an RFI for. The only reason I'm asking about this is it shows it's COVID related. But it's also reoccurring expense. Rarely do we enjoy reoccurring expenses that are COVID related. And I wondered if you could share with me what this expense is for and why we need it reoccurring.
Yes, sir. Certainly. So citizen scheduling was one of the applications that we implemented as a result of the pandemic. We sort of looked across what are some of the applications and business needs that the agencies had been asking for. We used CARES dollars for the initial development, and the recurring money is for ongoing software licensing so that we can continue to use the software solution that we implemented. Does that answer?
Sort of. I guess the thought is that what would be an instance and where we would need to have this service after a period?
Let me take that because it's a great question. One thing we've learned, actually, we learned this partially before COVID ever took place, and I'll say driver's licensing, I think, is a great example of this. When Governor Lee came into office, we started experiencing greater and greater lines out the doors for being able to receive driver's license. And so at that point, there was not a scheduling app for people to be able to go online and be able to schedule an appointment to go in and get a driver's license. That's one example of a need that we're going to have ongoing from now on. I think it's a better service that people, our citizens, expect. And so this scheduling process and opportunity, I think, will demonstrate itself in a number of departments that they'll be able to go online and even go on their mobile app and be able to schedule an appointment for whatever service that they may need from any particular department.
Commissioner, that concludes all the questions on my list for today. As I said, I know that you all will be with Chairman Williams, and I'm sure we'll have others at that point. But thank you for coming over a bit early and for spending the time with us, helping us understand how F&A works.
I'll say one thing to wrap us up. I know that this has been an incredible year for all of you and for your constituents, and I just want to say how much we appreciate what you've done and the input that we've gotten from you over this past year as we all try to better serve our citizens of the state. And so thank you for that. And we just appreciate what you've done, and we appreciate what our department's able to do as a part of that process. So appreciate that, and thank you, Madam Chair.
Well, as we know, it does take a village. This is a very large village of state government and a lot of branches, but we're pleased to be a part of that in this General Assembly, and we thank you for listening, at least sometimes when we call. Well, you always listen.
We try.
It's just a question of whether or not we get the answer we're seeking. But thank you again for being here. And next we will have Department of Commerce and Insurance. We'll again give our folks here just a minute to make sure we sanitize properly and not put anyone at risk. And then we'll proceed.
Thank you. I tell you, I have to put up with him today.
Good, yeah, appreciate that. We'll ask them. Got all hard questions out there. Good. You go. Big okay.
Yes. Y'all take care.
Just kind of under caution. And I've got in here, so I'll answer. I should be fine. Okay, so I'm going to sit on that side. So. Yeah. I'll be able to all quicker, but I'll still have this information, so I can't advance it if.
Are they supposed to wipe it down?
Yeah, I thought they were going to, but. Yeah.
She might be the one who did that. What we did last.
Okay, I believe,
You timed that perfectly, didn't you? Hey, I got a little behind the traffic. Really heavy traffic.
Pick back up again. The commute home has been terrible.
We're getting underway. Except the weekend. I did. I got out there yesterday, I was riding, and I didn't realize the time hasn't changed, so I got out and they took a note. I've been out 45 minutes in.
let the record show that this additional cleaning doesn't reflect in any way on our concern about F&A's germs. We just want to make sure that we're being responsible in our sanitation process. But Commissioner, welcome. Thank you for coming, and you and your team feel free to have a seat, and we're going to just jump right into your presentation.
All right. Well, thank you so much to the chair, vice chair, and the entire committee for giving us the opportunity to present today. For the record, my name is Carter Lawrence, and I am the Commissioner of the Tennessee Department of Commerce and Insurance, and pleased to be with you here today. Also, here in the room from the Department of Commerce and Insurance, I have to my immediate left, Deputy Commissioner, Chief of Staff, and Chief Operating Officer, Jennifer Peck. Also, Assistant Commissioner Paul Hartbarger, Deputy Commissioner Toby Compton, and Assistant Commissioner Alex Lewis. So again, thank you for the opportunity to present Governor Lee's proposed budget for the Tennessee Department of Commerce and Insurance. It really is a privilege to be here with you today. The Department of Commerce and Insurance is charged with a diverse range of regulatory and consumer protection functions, including overseeing the insurance and securities industries, managing the state fire marshal's office, and overseeing some 27 professions that represent approximately 300,000 Tennesseans. Additionally, the department is responsible for the Fire and Codes Training Academy, Firefighter Commission, Law Enforcement Training Academy, Peace Officers Standards and Training Commission, TennCare Oversight, and the administratively attached Tennessee Emergency Communications Board. Through our employees and programs, the important work done by our department daily impacts all 6.8 million Tennesseans. And as with all Tennesseans, all of state government, and each agency, 2020 was a significantly impactful year for the Department of Commerce and Insurance. In addition to the global pandemic, Tennesseans have had other natural disasters to recover from in 2020. The March tornadoes in Middle Tennessee, April tornadoes in Southeast Tennessee, and a derecho, which hit Middle Tennessee in May. I'm proud to report that, despite these challenges, we've witnessed the resiliency of our fellow Tennesseans, and our staff has had the honor and privilege to serve our customers in these difficult times. At the onset of the pandemic, we moved the majority of our staff to full-time work from home. And prior to that decision, just about a year ago, to direct our staff to work from home, Commerce and Insurance was well positioned for that move, already having approximately 75% of our staff working part-time from home. And immediately following the onset of the COVID-19 pandemic and working with SDS to overcome the remaining technology challenges, we quickly increased our work from home staff to 98% of the team. Now, that remaining 2% of the team that did have to come in the office was needed for critical mail and revenue processing, and they were provided with appropriate protective gear and also comprehensive health instructions. And currently, I'm proud to inform you that because we understand that many of our customers rely on in-person customer service, we have safely reopened our customer service center on a limited basis. So whether online or in limited in-person interactions, our customers are still receiving best-in-class customer service from our staff, and we continue to respond in a timely and efficient manner to all customer needs. So I'd now like to move on to some graphs that exhibit the impact of COVID-19 on our customers. As you can see, this first chart shows license renewals for our regulated professions, comparing total renewals by month for 2019 and 2020. While there was a dip in renewals in March and April of 2020, we've since witnessed a robust recovery that started in May. The decline in renewals in March and April was likely not due to professionals leaving their professions, but simply delaying their renewals thanks to the regulatory flexibility provided by the governor in the executive orders. The pandemic and move to distance-based customer service has further accelerated a long-term trend towards electronic-based licensing. Online applications for licensure have risen from an already robust 83% to now over 87%. Turning to the second slide on the impact of COVID-19 on our customers, you can here see a comparison of licensed insurance agents by month for 2019 and 2020. Thanks to our balanced regulatory approach, Tennessee is welcoming to new insurance agents, and as you can see, Tennessee continues to witness steady growth in this industry. At the end of 2020, we had over 225,000 licensed insurance agents in Tennessee, adding over 23,000 additional insurance producers, which compares to just over 200,000 at the end of 2019, and that represents an 11% increase over last year. In 2020, 55 insurance companies were newly licensed in Tennessee, bringing the new total to 1,907. To further assist the insurance industry, our division has also temporarily moved to all electronic filing, and we are working to amend our regulations to permanently allow for electronic filing. Additionally, we're implementing an electronic insurance agent permitting process, which in the past was done via paper. In this final slide demonstrating the impact of COVID-19 on our customers, you can see a comparison of electrical inspections by month for 2019 and 2020. Overall, the slide shows robust demand from our customers in this field, demonstrating that construction, as shown here via new building electrical inspections, remains quite strong. Turning now to the topic of the impact of COVID-19 on agency revenues, I'd like to point out slide 6, which shows the cumulative for fiscal year 2019 and 2020. As you can see here, total commerce insurance revenues for fiscal year 2020 was $1.25 billion, compared against $1.2 billion for fiscal year 2019. It represents a year-over-year increase of approximately 3.7%. For all divisions, fiscal year 21 and 22 revenues are expected to be at or beyond their pre-COVID levels. Slide 7 continues the theme of COVID-19's impact on revenue, comparing revenues from 2019 and 2020 for our insurance division, as well as the administratively attached Emergency Communications Board. For fiscal year 2020, our insurance premium tax was $1.039 billion, compared to $1.003 billion for 2019. This is a year-over-year increase of approximately 3.6%. The Tennessee Emergency Communications Board also realized an increase from $106 million in fiscal year 2019 to $110 million in fiscal year 2020, and this is a 4% increase for TECB. The final slide on the topic of the impact of COVID-19 on revenues compares fiscal year 2019 with fiscal year 20 revenues for the Fire Academy, fire prevention, insurance fees, regulatory boards, securities, TennCare oversight, and Toledo and the Post Commission. Between fiscal year 2019 and 2020, all of these had modest increases, except for TennCare oversight, which experienced a 4.9% decrease, and Toledo and the Post Commission, which experienced a 21.8% decrease in revenue, which is chiefly related to the cancellation of a class at the onset of the pandemic. The governor is proposing a base budget of $260,695,500 for the Department of Commerce and Insurance, which is an increase from last year's request of $227,914,500. This increase is predominantly from a statutorily mandated cost increase for E911, which requires that we distribute additional funds raised from the monthly surcharge increase. The governor's budget also includes $55,529,200 in departmental current service and interdepartmental revenues. The department receives $324,800 in federal funds, and the remaining $204,841,500 is comprised of dedicated and non-dedicated state appropriations. Non-dedicated state appropriations for commerce and insurance have been relatively stable and remain stable for our base budget request for fiscal year 21-22. The governor's proposed budget for the department includes funding for 828 positions, of which 612 are full-time and 216 are part-time. 828 positions does represent a decrease from the crest of 985 positions in 2011. And that reflects the departure of the Tennessee Corrections Institute, the Division of Consumer Affairs, and Fire Investigative Services from the department. And taken together, those three agencies represent 56 positions. The governor's proposed budget request does include a request for 3 additional positions to meet increased service demand from fiscal year 2021 and 22. I will discuss these 3 additional positions in more detail a little bit later in the presentation. Of TDCI's $260 million annual operating budget, all but $29 million comes from dedicated revenue streams that are statutorily mandated to fund the department's specific operations. And of the $29 million in general fund appropriations, $17.3 million represents pass-through money for payment of the annual police and firefighter pay supplements, which are set by statute. $2 million funds the captive insurance operations from their premium taxes, meaning the department utilizes only $10 million in general fund appropriations. The $10 million in general fund appropriations support the operational expenses of a limited number of activities in the department, including funding the Tennessee Law Enforcement Training Academy, Tennessee Fire and Codes Enforcement Academy, public safety certification programs at the Post Commission, and the Commission on Firefighting. General fund appropriations to Commerce Insurance have remained consistent between 2011 and now and have constituted between 11 and 13% of our total budget, and this year it represents 11.1%. The department has a robust efficiency plan, which is focused on the continued streamlining of processes and realizing cost savings while also maintaining a high level of customer service. It is vitally important that we maintain best-in-class service for our customers. And while the department was an early adopter of AWS, we continue to realize additional savings from the further implementation of AWS. To wit, $1.2 million from rent savings as a result of AWS implementation, which is attributed to the following divisions: $1,200 from administration, $396,000 from insurance, $613,000 from fire prevention, $67,000 from securities, $28,000 from E911, and $94,000 from the regulatory boards. The department was also able to save $54,600 from payroll equity savings in the TennCare Oversight Division as a result of abolishing one vacant position. For fiscal year 2021, the department plans to realize additional staff vacancy reductions. These positions include the following: 3 from administration, 1 from insurance, 16 part-time positions from the Fire Service and Code Enforcement Academy, 1 from E911, 2 from Toledo, and that's a total of 23 full and part-time positions for a total savings of $256,900. The department continues to carefully monitor and reduce spending where appropriate within programs that are funded by dedicated revenue streams. These efforts are reflective of the focus by all program areas to continuously improve and find ways to gain additional efficiencies. These efficiency measures have allowed the department to consistently revert savings back to the general fund. The governor has proposed the following cost increases in Academy: 1 cost increase for E911, the Post Commission, and the Firefighting Commission. And in addition, the governor is recommending 2 cost increases for miscellaneous appropriations related to volunteer firefighters. Turning first to E911, legislation passed in the last session increased the E911 surcharge on telephones from $1.16 per month to $1.50 per month. As a result, the Emergency Communications Board requests an increase of $34,918,900 in order to distribute the additional funds to the emergency communication districts. TCB will utilize these funds to sustain and enhance E911 at the local level. Turning next to the category of law enforcement officer death benefits, the governor's budget recommends an increase of $150,000. This increase is also related to new legislation, which increased the death payments from $50,000 for 1 year to $50,000 annually for 5 consecutive years. Funding currently exists to pay for 4 deaths. However, tragically, the commission is scheduled to pay for at least 7 deaths in fiscal year 2022, and therefore request an additional $150,000 for funding these additional death benefits. The governor is also proposing the following 2 cost increases for the Tennessee Law Enforcement Training Academy. First, $45,400 to fund the mandated annual trooper salary step increase, which is, of course, pursuant to statute. And second, $70,700 to fund the salary survey increase, which is determined by comparing trooper salaries with those in other states. The governor is also requesting 3 cost increases for the insurance division. First, the examination section requests 1 insurance examiner position to help meet the division's NAIC accreditation standards and reduce the high cost of contract examinations paid by insurance companies. Since the full price of examinations is paid by the insurance companies, it is expected that adding this position would result in no additional cost to the state. Second, to provide sufficient resources to support the growth of the captive insurance program in the state, the governor is requesting 1 additional position. This position would add capacity for additional and economic activity in Tennessee. We're proud that Tennessee remains one of the top domiciles for captive insurance companies, and we want to carry that good growth forward. Third, the governor is requesting 1 insurance financial analyst position for the insurance division. This position will review the financial solvency of insurance companies doing business in the state. This work is necessary to help protect consumers and provide for effective and efficient regulation. This position would replace work currently done by contractors and would save the department about $30,000 annually.
Commissioner, we had asked for a 10 minutes or less presentation, so we've gone a bit over. If we could just stop here and we'll let folks have that slide in front of them. If they have additional questions about that, we can get to them during our Q&A, but we really need to, we're on a tight timeline here. So thank you. First on my list, Chairman Williams.
Thank you, Chair Lady. Thank you, Commissioner, for coming. Last year, we passed a bill to allow for a new fee for 911 services. In so doing, the original fiscal note was $25 million. I noticed this year in the budget, there's $35 million in the budget. There's an additional $10 million over what we passed last year. I guess what gives? I mean, I thought it was supposed to be 25 million. Now it's 35 million. Did we just use a number and multiply it and we did some poor math, or was there something that we didn't know about?
So great question. And you hit the nail on the head with some calculation errors. And if it's okay, I'll let Assistant Commissioner Hartbarger talk to that a little bit more. But before I turn it over to him, I do want to point out that the additional funds, which we now believe are calculated correctly, will be paid out to the districts in accordance with the existing structure. So nothing will change there. And Paul, if you would expound on that, please.
There were 2 errors that were made in the calculation.
Excuse me, could you turn on your mic and, yeah.
Is it on? On now?
Mm-mm.
Okay. Hi, again, Paul Hartbarger. Thank you, Commissioner. Thank you, committee. We located 2 errors in the calculation that was provided to you to calculate this. One was, instead of calculating the amount of fee that would increase per subscriber, it was done on a pro rata basis, which led to, we can show you the math if you would like at some point in the future, but led to one part of the error. The other part of the error is it did not include prepaid cards and prepaid phones, was just simply not included. And so when those were included, the number increased as you see.
Well, I guess the question is, though, should we have increased the number as much, or is there a need for, I mean, every department in the state would love to have 10 million additional dollars than what they asked for. I guess the question is, should we revise this, or is it absolutely necessary to have the 10 million additional dollars?
So we would not want to speak on behalf of the administratively attached TECB as to those funds specifically. I do want to stress that the math that Assistant Commissioner Hartbarger was talking about is the correct application of the surcharge increase that was done by the joint resolution last year. So the numbers are definitely now correct. As to the funds themselves, though, with respect, would hand that off to TECB, which I mentioned is administratively attached, to allow them to speak to.
Okay, just one other follow-up question in regards to 911. Obviously, we had a Christmas Day bombing in downtown Nashville. the many of our constituents in areas across the state lost 911 service because of that. I guess the question is, have we done anything to ensure that doesn't happen? Did we get any federal funding to make sure that it doesn't happen? If you could speak to that, that would be good.
Yeah, absolutely. So there has been a lot of conversations, as you can imagine, as to the Christmas Day bombing and to future resiliency plans. Also, there is currently an RFP that is being formulated for the new contract for Next Generation 911 that the TECB board is working on and hopes to have live soon. As far as AT&T themselves, they have not yet appeared at the TECB board meetings, but I know there have been conversations about that, and there is a desire to hear directly from AT&T as to what happened and what should have happened and the conversation moving forward.
Just a follow-up comment to Representative Williams' original line of questioning. It does concern me a little, and I'm not faulting anybody's math or whatever, but the fact that we have inadvertently, if you will, provided an additional $10 million resource to an organization does give me pause, and I think it's something that we might need to look to those organizations to do some additional redundancy, reliability, some other kinds of functions that could be funded with that $10 million, because the fee was predicated on them being able to do X. Now they have X plus Y dollars at their disposal, and I would really like for some organization, this organization and others, to have a little bit of oversight, control, input, if you will, into how that additional $10 million is allocated. So just as point for the record. Next on my list, Representative Lamar.
Thank you, Chair Lady. The miscellaneous appropriations portion of the proposed budget includes almost $5 million recurring to fund administration legislation relative to volunteer firefighter training. So my two questions are very quick questions. Would your department administer this in the same way you administer the current firefighter training supplements? And would the funding being used, would it be similar to the 800 supplement that's currently available to firefighters and police?
Yes, thank you for the question. And that's absolutely right. It would be administered in the same manner and would be available just at the different amount that's available to them for the volunteer firefighters. And we're really proud of this piece of legislation because the majority of Tennessee still relies on volunteer firefighters, and it's the backbone of the firefighting service in Tennessee. And continuing to professionalize and incentivize new entrants into this is vitally important to protecting lives and property, and we're really proud of the inclusion of this in the governor's budget.
Thank you so much, and thank you for your support for firefighters. They are vital community servants, and let us know how we continue to support.
Thank you.
Representative Sexton.
Thank you, Madam Chair. This is following along the same lines as Representative Lamar's questions about the volunteer firefighters. And I'd just like to comment that being from a rural area, I've got 3 counties and only have 1 fire department that is included in the city budgets. All the others are volunteer. And back in the late 70s, I suffered a home fire, and it was the volunteer firefighters that came out to extinguish the fire. So I see that they constantly are having problems with funding. They have to raise their own money. They have to have barbecues and everything else and rely on the community some. So my question is, with this miscellaneous appropriations portions of the proposed budget, it also includes $1 million to provide non-recurring funding for support grants to the volunteer fire departments. How will the grants be distributed, and what will they be used for?
Yeah, thank you, Representative, and fantastic question. We're really proud to talk about this. This proposal is an increase from last year's budget of $500,000, which we were able to successfully administer for providing equipment funding. Because as you know, a lot of the volunteer fire departments are using woefully antiquated turnout gear, which of course threatens the lives of these volunteers who are keeping us and our property safe. So in the same way that that $500,000 was administered last year, we would administer this $1 million this year, where we are providing this money for equipment for these volunteer fire departments. So it's primarily focused on the turnout gear, which we have had conversations with some volunteer fire departments that are using 20, 30, even 40-year-old equipment, and there's generally a 10-year lifespan on that equipment. So we're really proud to be able to help bridge the gap between what you correctly identified as some underfunded volunteer fire departments, which are critically important, especially in our rural areas.
You may have answered this, but will it be similar to the 500,000 that was proposed in last year's budget?
Yes, sir, it would be.
And if I may, Chair Lady, one other question. I would like, if I can get this, some kind of report that says to which counties these monies went to and how much. I'd like to, and I'm sure other representatives as well, would like to know what's going to their counties, because they're woefully underfunded in every way. So, there's no administration costs, no labor costs. It's just trying to buy equipment and keep diesel fuel and gasoline and that sort of thing. And they really do provide a great service. They even keep our insurance down. When we have a volunteer fire department, it greatly reduces the amount of fire insurance that we have to pay on our businesses and our homes. And so I would like to see more attention put to these, obviously because I'm from the rural area. But thank you for what you're doing. I'm glad at least we're paying attention to it.
Yes, sir. Thank you. And we would be happy to provide that report to you and to the entire committee.
Thank you. If you could just send that to my office and we'll get it distributed to the committee as a whole. Are there other questions for the commissioner? All right, Commissioner, thank you again for coming, being with us today. Thanks for the information that you provided. And I think we may be having some additional conversation about the E911 issue. And I think this committee would appreciate an update on Chairman Williams' question as to what we're going to do in a world that continues to surprise us with tragedies that can happen, what we're going to do to make our 911 system more redundant. So if you can just kind of keep us in the loop as those conversations occur, we'd appreciate it.
Absolutely, we will. And apologies for speaking slowly. I promise. They put together a script that would have been within the time. Evidently, I just spoke a little too slow.
Well, all of us up here are Southern, so we totally understand that.
Thank you.
Next, we'll be hearing from the military. Again, we will have our quick break for cleaning. Water would be great. Okay, we're set to finish at 1 and
Kevin, sit up here.
Right up here? Yeah, I'm making it up as I go.
Gotcha. The only question, get me recalled back.
Welcome to our military department. General Holmes, we appreciate you being here with your team today. And as one of my committee members pointed out, it's fitting that you are here now with this group. We are the few, the proud, the remnant of the Finance Committee. We are the dedicated part of this group. But we do, as you know, there are competing activities here in the legislature on a regular basis. So we've had to have some people step in and out. But don't think that's a reflection on our interest in what you're going to share with us, because it is not. We're very interested. And with that, I would just turn it over to you and ask you to proceed with your presentation.
Okay, thank you, Madam Chairwoman. I'm Jeff Holmes, 76th Adjutant General. I've got a host here with me, so I'll just go around and introduce each one of those. Patrick Sheehan to my left, the Director of TEMA, and then Colonel Jason Glass is our Assistant Adjutant General Air. Kevin Alexander, extreme right, is our Comptroller, new Comptroller, 2 or 3 months now, so glad to have him on board. Melissa Hucks is TEMA Chief of Staff. Colonel Milligan, Facilities Management Officer, and Libby Donahue is the General Counsel. Dennis Adams, Director of Administrative Services, and then Nick Atwood is my Legislative Liaison Officer. And with that, I would just kind of, excuse me, go through just a kind of a summary, wave tops, in order to kind of present to you our top items, primarily focusing on some of our increased items, and then let you ask questions, and then we can do a deeper dive on any one of those categories. So, Madam, as a frame of reference, our total funding is approximately $107 million, and that includes both federal and state. Frame of reference, our National Guard, we really have 2 primary divisions, the National Guard component, which both consist of Army and Air, and then we have TEMA, and we have a small percentage that's administrative services, things like war records, things of that nature. We have a total of 15,123 department members, and that includes both Army and Air, TEMA, federal technicians, active guard members, and contractors. We have 5 budget items today that we'd like to present. 2 of those are TEMA related, and then 2 of those are Army National Guard items, and then there's some subcategories within that. I'll start with Tennessee Emergency Management, and then I'll defer to Director Sheehan to go through the details, but they represent 2 items that we'd like to discuss, and those include the TEMA warehouse, which is a significant item, and obviously it's been very important here in the past year. And we're asking for $1.2 million recurring state dollars for that. And then we can discuss the TEMA regional office in Chattanooga, which is the 4th TEMA office. And there's some data that's driving the need for that. I think there's a very well thought out pro forma that illustrates the cost savings of establishing that based on population growth. And then the efficiency of saving travel time of trying to service that region with our 3rd office, both Middle Tennessee and East Tennessee, and just simply the travel time it takes to get down there. And that can be a portion and equate that back to actual productivity. So I'll defer to Director Sheehan if he wants to elaborate on any one of those 2 items.
Thank you, General, and thank you, ladies and gentlemen of the committee, for having us. So we,
If you would, for the record, just identify yourself and your title, please.
Yes, ma'am. My name is Patrick Sheehan. I'm the Director of the Tennessee Emergency Management Agency. We, no surprise to anybody that's living in Tennessee or in the General Assembly, that we've done a lot of warehousing operations since COVID to provide personal protective equipment and medical material. And we have a warehouse now. It's funded 100% federal funding as an eligible expense, but at some point that will sunset, and there is some thought that we should have some level of warehousing carrying forward. And so this 1 year non-recurring ask here is to buy us time to figure out what that permanent or longer term footprint should be. And it also buys us time to surplus and do other administrative things that may be outside of whatever the period of performance or eligibility for the federal grants are. For the Chattanooga office, I think in the last year, I mean, it's hard to believe this is 53 weeks ago today since the tornadoes of March 3rd. But we also then had tornadoes in the middle of April that hit from Chattanooga, as you're aware, ma'am, all the way up eastern part of the Eastern Grand Division of Tennessee. And for some time now, General Holmes and myself had been monitoring how much time our district coordinators were spending what we call windshield time. So driving to meetings, driving to meet with our county emergency management partners, our first responder partners. And we hypothesize that we can turn that into time of productivity, time where we're shoulder to shoulder, time where we're actually training and improving, as opposed to time spent just burning rubber on asphalt. And so that's the genesis behind when we examined the number of hours we were spending, our team was spending on the road, this idea of a Chattanooga office with some of the hazards that are there, I think just makes good business sense.
And we are very happy to have you have a permanent location. You guys have been incredibly responsive. I hear great things about you from the other community leaders, but it will definitely help to have you on the ground all the time. And I think help us all to be better, more responsive.
Thank you, ma'am.
Okay, if no further questions, ma'am, we'll move to the military portion of the budget increases. The first one is for two positions, one of those being an assistant commissioner, which would be the Deputy Adjutant General of Army, and it would be a similar position to that Colonel Glass fills on the air side. The result of that, as what I pulled up, I now have a Deputy Adjutant General, Major General Tommy Baker, and so he's a dual-hatted state federal employee. Moved him up as my deputy, and then that vacated the Assistant Adjutant General Army position. We filled that with a federal technician, a dual-hatted technician. So that was just a result based on the opportunity. That individual, Brigadier General Cole, was already a federal technician, so we just elevated him up, and it's still that technician, but it does need to convert to the dual-hatted state federal because he's, it was just an opportunity because of his position. So it's not saying that the next individual that would fill that position may not be a federal technician. So we wanted to get that authorized. The second item has to do with armory maintenance expenditure increases, really focusing on the initiative of deferred maintenance with our facilities. We are asking for $490,000 state dollars, which will be matched with an equal amount of federal dollars. And that supports our facilities deferred maintenance. We've categorized the various levels of that, focusing on items that would ultimately put the state at risk for funding roofs, as an example. So with the roofing warranty, there's certain required inspections that have to be performed, or otherwise the warranty would be invalid. And this covers things of that nature. And this has to do with HVAC systems, roofs, other things to maintain and get the true life out of that warranty. And then the other deferred maintenance items are efficiency items, where it could be water leaks or just system upgrades. They don't make parts for the system or anything like that, and you would spend more money. And these are small system replacements, but you really wouldn't have the ability to fix a lot of those components. And so that's really the basis of our cost increases. It should be noted that previously we've been funded on 86 cents on the square foot for our facilities. This would put this not up to industry standards, but more appropriately funded to get at some of those deferred maintenance items. And we have 30% of our buildings are over 52 years old, and we have a total of 3 million square feet and over 200 buildings. And the average age of all our facilities is 35 years old. But we do have 52, we had those that are 52 years old, 30% of those, and that's sometimes a struggle. Madam, subject to any follow-on questions, we'll be glad to dive into each one of these or individually or address any other items you may have.
Thank you, General. We do have some questions and questioners on our list, beginning with Chairman Whitson.
Thank you, Madam Chairman. General and Director Sheehan, really appreciate y'all being here today, and I have great respect for you and your team. Y'all do great things for our state, and it's recognized. And my first question was, can you get me back on active duty? But that was not on the list. That was
No, sir, but I could get you in the State Guard tomorrow.
Friend told me if I go back on active duty, we've lost the war, so we're in bad shape. This may be more appropriate for Director Sheehan. It regards the unfunded request. In addition to the 11 positions that are proposed to establish the new TEMA regional office, the department requested an additional 9 emergency management positions for around $900,000. They were not included in the proposed budget. Can you tell us what those functions that will be performed by these new positions, Director?
Chairman Whitson, so I just want to clarify, what would the 9 positions that were not funded be for?
The department requested an additional 9 emergency management positions that were not included in the proposed budget, is what I understand.
They were programmatic positions to help address some of the increased and anticipated workload, and things like increasing the number of people that can help with adjudicating NFIP requests, National Flood Insurance Program, which has been under TEMA for about 2 years now, and some other programmatic things that we asked to explore.
Thank you, Madam Chairman.
Representative Garrett.
Thank you, Madam Chairman, General, Director. Colonel, thank you all for being here today. You had mentioned it briefly in your earlier remarks with the warehouse, the $1.3 million in the budget for the warehouse. What sort of supplies will be stored there? And then I guess secondly is what we're going to do if we have a disaster, make sure those supplies don't expire. What's the basis of that warehouse? If you could elaborate, that'd be great. Thank you.
So we have material stored and have for years for shelters and foodstuffs and water in some limited fashion. In some of our buildings that are getting, they're probably on the old side of the average age, definitely over 50 years old. And there's not been a slowdown in disasters since I have started here 5 years ago. In fact, I would say, not because of me, but the number of disasters has increased in Tennessee. The pace of them seems to be quickening. And it's not just Tennessee, it's also our neighbors. And so we do a good job currently with turning over foodstuffs that we use, shelf-stable meals and bottled water and shelter kits. And so shelter kits are cots and pillows and blankets and sundries that are necessary because, quite frankly, we're going to have other things that are going to cause us to need to open shelters. If it can happen, and if it has happened, it will happen again. And part of what we're charged with statutorily by this body is to prepare the state for catastrophic disaster. And we have opportunities to improve that. So certainly medical equipment will be a part of what we're storing in the future. N95s, a year ago, N95s were not to be found anymore. So for me, the stress of that still lives pretty close to the surface of how difficult it was for us to get things, and we just didn't have them in inventory. And so this warehouse will be used to help store those things as well. Gowns, masks, gloves. To the second part of your question there, what will we do to help maintain them is I intend that we'll partner with hospital systems and the Tennessee Department of Health to find ways to turn that inventory over. So rather than just buying a generic N95 respirator, for instance, we would find what are the hospital systems using, and I would think that they would be open to increasing as a measure for the common good to helping us turn over inventory. So when they order whatever brand of N95 respirator or whatever brand of latex or non-latex gloves, that they would work with us to turn that over so that we always have a churn in our inventory. I think we can probably do better things with our water and our food to help turn that over. And we're certainly examining ways for us to be more cost effective and better stewards of Tennessee's tax dollars. But those are the kinds of things we're looking for longer term with our warehouse to prepare our state better for what we know is going to happen and to find ways to do it more effectively with the private sector, with other public partners. And that's what we hope to accomplish. Thank you.
Thank you, General, Colonel, Director Sheehan, thanks for coming. I noticed you found your, in the pandemic, you finally found your razor. Last time I saw you, you had a
Yeah, that was to
mustache.
celebrate the holidays, because that's probably the only way I'd realize it was a holiday.
Yeah. But I wanted to ask about TEMA, Director Sheehan, received, I think it was $250 million in CARES Act funding as related to COVID-19. Just wanted to get a quick update on where we are as far as the funding of that. For instance, of the $250 million, have you utilized most or all of it? And just kind of see where we are on the balance of those funds.
Sir, so we're actually in the process of deprogramming most of those CRF dollars now. So the new administration made some changes to eligibility for the Stafford Act. And so we're in the process now of working with Mr. Nick Najad, the governor's policy advisor, and Commissioner Ely and the F&A team to reprogram those dollars against Stafford where possible. So FEMA did a couple of things at the new administration's request, which is one was anything that was deemed eligible from 20 January 2020 to 21 January 2021 that FEMA had already deemed eligible, they're covering at 100% cost share now. Similarly, anything moving forward from 21 January 2021 to 30 September of this federal fiscal year that we find ourselves in now, they've also deemed to be 100% eligible under Stafford Act. So we were using those CRF dollars as the 25% state and federal cost share, and state and local cost share for the non-federal share, and we're no longer in a position where we have to do that. So we're working to fine tune what those figures are now. Now, we did do a lot that is still considered ineligible last year. So when we provided PPE, sanitation materials, cleansing supplies to every classroom in the state of Tennessee, FEMA deemed those actions ineligible as an increased operating cost. These partitions here, for instance, FEMA deemed those as an increased operating cost rather than an extraordinary measure for the pandemic. I disagree with that. We continue to fight them on it. But at this time, those types of actions will still be funded under CRF.
Okay, so, well, if you could, based upon what you're telling me, there's still some unutilized dollars there. I think what this committee and the chair lady and I would like to see is how we're doing that and how or if we're still able to do that. I would say that these dividers mess with productivity a lot, I would say. But they are obviously needed here as well as in the classroom. But if you could provide us with that information, that would be really good. And any federal dollars you were able to utilize for state programs would also be good. We just want to, we found that the printing press in DC has not began to ease at all. And even though we have a plethora of monies coming to the state, it's very difficult to utilize them in efficient ways and still meet their parameters. And it's my understanding we're probably going to get another almost $4 billion in this next phase. So would really appreciate your help there if we can. Thank you again.
Yes, sir. Thank you.
Chairman Baum.
Thank you, Madam Chair. And General, you mentioned in your presentation $490,000 in funding for maintenance on the armories. I think the proposed budget also has about $800,000 for capital projects. And my first question is, how much of your deferred maintenance on capital projects will the $490,000 on the Armories address?
I will probably defer to Colonel Milligan sitting behind me. Some of the deferred maintenance items or the maintenance type items will actually prevent from having a capital project. So if we have this money, then we can do small repairs, whereas we would have to wait if we didn't have this money and apply for, MILCON dollars to get a capital projects established, which then could take a couple of years. Then we'd have to get a designer, and then we have to go through all that process. And then while at the same time that cost escalation is happening. So we kind of took a look at the either or, if you just wait until you ask for the money based on the capital project, or you put it in an account so we can maintain those without drawing it out to a longer period of time and it having that additional growth or acceleration of cost, and then the additional cost of designers and so forth. And I'll defer to Colonel Milligan to add any other items.
Thank you, sir. Colonel Andrew Milligan, I'm a Facilities Management Officer. We currently have 38 capital projects going right now, roughly 40 million, about 25% of that state share. That number is not going down until we can see the impact, how much improvement we'll make. This increase gets us all of the predictive, preventative stuff that we've got to do. We still have those small projects that are not to the building commission level. We'll be able to address the majority of those that we have. But year to year, the goal is to reduce the capital outlay requests that we've been submitting. And that's how we've lived for the past several years, is through capital outlay. Subject to your.
Thank you. And if you were able to total up all of your capital projects, what portion of that is in the form of deferred capital maintenance?
On our capital maintenance side, sir, it's all deferred maintenance. By nature of the definition, a capital improvements project that takes a space that has been completely neglected and converts it, the current project that we successfully bid this year in Knoxville points to that. That's truly a maintenance item, but we're doing so much to the building to bring it up to code, it falls in the improvements category. So outside of building a new facility, which we are replacing our McMinnville Armory this year, that passed last cycle, it's all deferred maintenance, sir.
Okay, thank you.
Thank you, sir.
Representative Shaw.
Thank you, Madam Speaker. Just a quick question. How many men and women in Tennessee are ready for active duty today, and how do we compare, if there is a comparison, with other states in terms of percentage?
Well, sir, I'm so glad you've asked that question, because I'd like to brag about that. So Tennessee is the 7th largest populated state, and we have provided the 4th number of soldiers and airmen deployed since 9/11. So we have far exceeded our, I would say, responsibility as a state. And I would say that we have a number of units that have been deploying quite often. We have Armored Cavalry Regiment, the 278th Armored Cavalry Regiment, that we just got additional dwell time. So up until actually this year, they were deploying 1 in every 4 years. So 3 years dwell time, 1 year's deployment. Now we've extended that to 5. That's just so our soldiers can actually just maintain a civilian career, maintain a family, and then deploy and meet those needs. Okay. We have 3 wings in each Grand Division of the state. They are completely operational, many of those every day and every night. The Air Force rely on us for refueling with our KC-135s out of Knoxville. Those are operational virtually every week. We have mission. The C-17s, those aircraft brought the first PPE and test swabs from Vicenza, Italy into Memphis, the very first of all the 54 states and territories. So our forces are relied upon heavily by the Department of Army and Department of Air Force. And we just mobilized our HIMARS battalion, Field Artillery Battalion yesterday. Frankly put, the combatant commanders desire our force structure, and they appreciate the readiness that our soldiers and airmen maintain in order for them to be used globally on par and parallel with the active component. Sir.
Thank you, sir. And Madam Chair, I just promoted you to speaker. Yeah.
I noticed hopefully the real speaker did not. Thank you, all of you, for being here and for the work that you do to protecting the state and this nation. I think you've your comments, General, just now pointing to the fact we are the Tennessee volunteer. We are the volunteer state for a reason. And I think it's important to note, as you did, that we not only have people who volunteer, but they're capable. There's all sorts of people might volunteer, but they might not be worth so much in the field. So we appreciate the fact that you make sure that the folks in your command are prepared and are, willing, not only willing, but ready and have the training to do what they need to do when they're deployed, either overseas or, in our own. You guys have played a huge role in COVID relief. There've just been so many places that you have, your folks have stepped up, and we appreciate it so much. So thank you for being here. Thank you for all that you do. And with that, we will be back in session.
Thank you.
And
Thank you.
Thank you again. All right. That completes our calendar for today. If there are any further business to come before the committee. Good. Seeing none, we stand adjourned.